It was appalling to question President John Kennedy's loyalty to the United States because he was Catholic. I'm glad that Congress is voicing its opposition to anti-Semitism and made it clear that dual loyalty smear is unacceptable. Unfortunately, it was also clear from the discussions this week and the ultimate resolution that treating anti-Semitism is being treated differently than other forms of bigotry and hatred. There shouldn't be an asterisk next to anti-Semitism, and I'll continue to fight it.
Time has expired.
Thank you.
How much time do I have, Mr. Collins, have?
The gentleman from New York has 4 1/4 minutes.
How much do I have?
The gentleman from Georgia has 4 minutes remaining.
I reserve.
The gentleman reserves. The gentleman from New York, Mr. Nadler.
Mr. Speaker, I now yield 45 seconds to the distinguished gentlelady from Florida, Ms. Wasserman Schultz.
The gentlelady from Florida is recognized.
Thank you, Mr. Speaker. One thing we are all reminded of this week is that words have power and divisive words cause pain. Every Jewish person in America, no matter where they are from, could share a story of deeply painful anti-Semitism that they have personally experienced. For me, at its worst, Nazi-obsessed Internet trolls mercilessly taunted my children with Holocaust threats too vile for me to describe on this floor. And this pain is frequently felt by all too many Americans. How you look or speak, who you love, or where you live and pray can still invite unwanted and potentially dangerous words of hostility. The conversation today about anti-Semitism, allegiance, and loyalty is necessary because remaining silent against hatred and bigotry is not an option. I'm a second-generation American on both sides of my family. 2 generations later, it was possible for me to become a member of the U.S. Congress, only in America. So questioning my allegiance is painful and personal. Unfortunately, this dual loyalty question is not isolated to Jews. Words have power. We must carefully choose our words and make sure that we use them to unite us and not to divide us. I yield back.
The gentleman from Georgia is recognized.
I reserve.
Gentleman reserves. The gentleman from New York.
Mr. Speaker, I now yield 1 minute to the distinguished Speaker of the House.
The gentlelady from California, the Speaker of the House, is recognized.
Thank you, Mr. Speaker. I thank the gentleman for yielding, and I thank him for bringing this important resolution to the floor of the House. I commend the gentleman from Maryland, Mr. Raskin, and the gentleman from Louisiana, the very distinguished gentleman from for his participation in writing this important resolution. It is in the spirit of unity and solidarity with my colleagues as we come together in this chamber of our American democracy to condemn all forms of hatred, racism, prejudice, and discrimination with a hopefully single and strong voice. It is profoundly disturbing reality that anti-Semitism is on the rise in America today, and anti-Semitic attacks increasingly are at the highest rate on record. Appalling acts of hatred and bigotry are being inflicted on all elements of our society, be they African American, Latino, people from Asia, attacks in terms of people being Muslim or other religious faiths. This isn't who we are as a country. We all believe that there is a spark of divinity in every person who exists, that we are all God's children, and that we come to meet with each other in a way that commands respect for that provenance of our being all God's children. And then we see people making attacks on each other throughout the country, whether it's in Charlottesville or whether it's anti-immigrant attitudes that have reared their ugly heads in our country. And it is in that spirit that I come to the floor almost emotionally to speak about this. In the Congress and across the country, we must accept debate on any subject in a legitimate way, whether it's on our U.S.-Israel policies and the rest. That is protected by the value of free speech and democratic debate in the United States and in Israel. Israel is our friend and our friend in that region. We support Israel out of friendship, out of shared values, but also because it is in our national interest to do so. But not every one of us in this body agrees on every provision of our or any consideration in that relationship. That's a separate and complete issue from anti-Semitism. Anti-Semitism, whether it's an form of attacks on Jewish people, anti-Semitic tropes, prejudicial accusations, or any other form of hatred, is deeply and unequivocally offensive and must be condemned wherever it is heard. And all of us must remember, as members of Congress, as President of the United States, that our words are weightier once we cross the threshold into Congress, and indeed they weigh a ton when someone becomes the President of the United States. It's also disturbing that Islamophobia and white supremacism remain a sinister and shameful presence in America today. Too often that goes under-noticed or unchecked. Such attacks are even targeted some of us in this body. We must condemn these attacks and confront them. As members of Congress and Americans, we have a solemn, urgent responsibility to fight to end the scourge of bigotry, racism, and hatred in our country. I do want to again salute our colleagues, Cedric Richmond, our distinguished former chair of the Congressional Black Caucus and now distinguished leader in the WHIPS operation, for his leadership in shaping this legislation, and again, Congressman Jamie Raskin of Maryland for his leadership role in all of this. I salute all of our members for demonstrating the courage to have this difficult conversation and for doing so in a spirit of great respect, disagreeing sometimes, but never questioning the patriotism or motivation of anyone with whom we serve. And I thank you, Mr. Chairman Nadler, for the important work as chairman of the Judiciary Committee that you have done to give us this moment, this important moment on the floor of the House. With that, I hope that we will have a unanimous vote in support of this resolution and yield back the balance of my time.
The gentleman from Georgia is recognized.
I reserve.
Gentleman reserves. The gentleman
Speaker,
from New York.
we're prepared to close. Does the gentleman...
Who's last? Gentleman from Georgia is recognized.
Thank you, Mr. Speaker. Before I yield in just a second, I want to go back to something. I appreciate the words that have been said here. Again, I cannot emphasize this enough. It took 7 pages to describe what it simply can be said is don't hate, watch what you say. You're a member of Congress. We deserve better. The House deserves better. When we understand this, then we can begin to understand also, I want to go back to something that I will hit again. It goes back to this is, again, something put together because we couldn't come to agreement on the very nature of what started this, which was anti-Semitic comments, and to having to have some of our Jewish legislators come down here and condemn that is sad, wanting to have to vote for something that at the very heart tore them apart, and you could hear it in their voice. But yet, they have to vote for this. We also put it together, getting at 3:20 this afternoon, having to get this. We left out the Church of Jesus Christ of Latter-day Saints. We left out Wiccans. We left out Jehovah's Witnesses. We left out disabled people who are often discriminated and had hateful things about. We also, in the thing, found out that the only ones that we're going to condemn getting death threats are Jewish members and Muslim members. We're not condemning anything else. This is just another attempt to rush to do something, to fix something. As I said last week, and I'll say it again, what makes you feel good doesn't always heal you. This is another example of a rush product. With that, I yield the remainder of our time to 1 minute. I'll yield 1 minute to the gentleman from California.
The gentleman from California, the minority leader, is recognized.
Thank you, Mr. Speaker. I want to start by thanking a member from the other side of the aisle, Chairman Elliott Engel. Thank you for when you heard the language that you stood up. Thank you for your work. To all the members that are here, this shouldn't be this hard. We should not have to go through the number of versions that we had to do. We shouldn't have to be on this floor even speaking about this. I hope we won't be back. Of all the things that have happened this Congress, this is what we've talked about the most. This is the action that this Congress has taken the most. Twice. Twice we have to make a statement that we're opposed to anti-Semitism. The first time, it took the minority that doesn't have very many abilities to bring something to the floor, but we did, and we spoke with one voice. But now we're back in a few weeks stating the same thing, but without apologies. Without apologies from that voice. It did not have to be this hard. We didn't have to break 72-hour rule that you put in this year to make it less than an hour, because fear of what would happen tomorrow on a motion to recommit. I will pledge to you this, from this side of the aisle, and I hope you understand this clearly. Any hatred, we take action. I hope you've seen from the action on this side of the aisle of where we stand. We didn't have to have a resolution, but when it came to the floor, we voted for it. We took action before it came to the floor, and it wasn't simply, please apologize. It didn't have to be this hard. Yes, Mr. Speaker, our Madam Speaker was right. America is better than this. But to my members, Congress is better than this. Please, do not make history write about our time with these 2 years that the most we've ever done is that we had to keep bringing resolutions to the floor to tell people that anti-Semitism is wrong. If that's the only action we're going to take, I know we're better than this. I yield back.
The gentleman yields back. The gentleman from Georgia has 1.5 minutes remaining.
And I'm reserving.
The gentleman reserves. The gentleman from New York.
Reserve.
Gentleman reserves. The gentleman from
So the gentleman is ready to close?
Yes.
Okay. Mr. Speaker, as we come to the conclusion of our second time doing this, I'll echo the sentiments of our leader who just spoke. I echo the sentiments of most everyone who has spoke here, that this is wrong. You know, one time we should learn. 2 times we're getting nothing out of this anymore. Because undoubtedly we're getting numb to it because we just put everything it can imaginable that we could think of in the short amount of time unless somebody brought it up into a resolution and say, this is hate, we don't need to do this. We don't need a manual to tell us who we can't hate. How is this so hard? Why do we blow process? Why do we disrespect this institution? By bringing together things that are thrown together at the last minute, that leave out death threats to any other member besides 2 groups of members, that leave out others who have been hated upon. It breaks my heart after just a day or so ago speaking of the institutional spirit and hearing the Dean of this House talk about working together. It breaks my heart that we're 8-9 weeks into this session and this is our largest accomplishment, telling the world, don't hate. That's our largest accomplishment. Mr. Speaker, my fear is, with this today, I don't want to be here again. But with the way this was handled, I fear we may be. We're better than this. This should not be where we're at. Why do we keep coming back? Because many times members forget the awesome responsibility that they have been given as members of Congress. Our mouths and our tongue can be our greatest enemy. Let us remember that as we seek guidance each day. With that, I yield back.
Gentleman yields back. The gentleman from New York is recognized.
Mr. Speaker, I now yield the balance of our time to the distinguished gentleman from Louisiana, Mr. Richmond.
The gentleman from Louisiana, Mr. Richmond, is recognized.
Thank the gentleman for New York for yielding. Let me just say that we are better than this. And we've seen in this body where we've had members attacked. And we came together right here in this body where we all held hands and we said that words have consequences and we were going to do better. We were going to set an example. And before we could walk off the floor, there was a commercial running to attack the character of our then leader, Nancy Pelosi. So hollow words mean nothing to me. Booker T. Washington once said that we are as separate as the fingers, but we are as whole as the hand. So we come together today, hopefully as whole as the hand, to condemn anti-Semitism, bigotry, racism, all of the phobias, Islamophobia, homophobia. What we do is push love, like Dr. King said. But in the eulogy for Dr. King, Dr. Benjamin E. Mays blamed in part the American people for the assassination. He pointed out that the assassin heard enough condemnation of Dr. King and of Negroes to feel that he had public support. So when Dylann Roof murdered 9 worshipers in Charleston, he thought he had public support. The shooter at the Tree of Life Synagogue in Pittsburgh thought he had public support. The neo-Nazis and the white nationalists who marched in Charlottesville thought they had public support. The shooter of Gabby Giffords thought he had public support. The shooter of Steve Scalise thought he had public support. What we're doing here today is making it unequivocally clear to the public that no one has the support to engage in discrimination and racism and anti-Semitism. But Dr. Mays went on to challenge us as Americans to do better. He said we, and not the assassin, represent America at its best. He said we have the power, not the prejudice, not the bigoted, not the anti-Semite, not the assassin, to make things better. So we too in Congress have the power and the obligation to make things right. Though we come from dramatically diverse backgrounds and though we have lived very different lives, we must all right now stand together against bigotry. We must make clear to those who traffic in all forms of hatred, neo-Nazis, white nationalists, racists of all kinds, anti-Semites, Islamophobes, homophobes, transphobes, and those who demonize and demean immigrants from Latin America and throughout the world, that they have no place in public disclosure. And for the record, this will be our 3rd vote on anti-Semitic measures. We voted against both of them. You all voted for one and then voted against the next one.
Niels Lesniewski is a senior Senate staff writer for CQ Roll Call, and he joins us ahead of the Senate debate and vote on the resolution to terminate the president's national emergency declaration to build a southern border wall. Niels, when is the Senate expected to take up this resolution, and what's the current plan for the debate and votes?
Well, most likely the vote is actually going to be on Thursday, because the Senate is about to depart for a week-long recess for St. Patrick's Day. So this will likely be the last bit of legislating that the Senate does before it leaves. What we're really looking to see is whether or not the Senate Republicans get together and can muster the votes to try to at least amend the resolution of termination as it came over from the House, that would effectively stop the national emergency designation for the southern border wall and for border security. We don't yet know whether or not there will be enough Republican senators who will be supportive of making any changes to the resolution as it came from the House.
And then the House, of course, is passed in the House last month. 245 to 182 was the vote. 13 Republicans in the House supported the resolution. What do you think we're going to see in terms of a breakdown in the Senate, and which Republicans do you think might support the resolution?
Well, so we're expecting at least a handful of Republicans to support the resolution. There are several who are already involved. Susan Collins of Maine is the lead Republican sponsor of the Senate version, Lisa Murkowski of Alaska, Tom Tillis of North Carolina, and Rand Paul of Kentucky are all already on board. We expect that if push comes to shove and there has to be an up or down vote on that resolution as it is, there are several other Republican senators who have been waiting to see what the Department of Defense wants to reprogram, where military housing or construction projects or whatever, what they want to sort of take the money away from to build the border wall. If the vote occurs before any of that information is public, it probably becomes a more lopsided vote.
Okay. Well, you recently wrote about the Majority Leader, Mitch McConnell, his view on the emergency declaration itself. What's been his view of the resolution to end it? And also, how is he influencing other Republicans?
Well, Senator McConnell seems to be sort of keeping his powder dry in terms of the influence on other senators. McConnell had said, of course, that he would support the president's emergency declaration, but he has not exactly been very strident in his support for it. He has generally demurred when asked about the actual legality of the emergency declaration. And so I think it's a message from McConnell to Republican senators that they should do what they think is best. Now, of course, on the other hand, we have been hearing in recent days that the Trump administration has been getting sort of louder and louder in terms of pressuring Republican senators to try and keep the vote total down. But I don't think that they're going to get this down low enough that it will somehow not pass.
So if the resolution does pass the Senate, we've been hearing the president plans to veto it. What are the next steps then for the House and the Senate?
Well, so then we would have this veto override situation that would have to play out after the March recess week. And we don't expect that there would be enough votes in the House. You mentioned the tally earlier when it passed the House. We don't think that there's enough votes in the House to get to a two-thirds majority to override a veto. So then we're basically on to both the courts and into the next round of feuding over appropriations. Remember that there have been so many disasters of the natural disaster variety, not of the questionable disaster declaration at the border variety, that Congress is going to need to do an emergency supplemental spending bill to deal with, tornado damage, hurricane damage, and the like. And that is probably the next place where this becomes an issue because there we have, emergencies that everyone will agree are emergencies. And so there's going to be money spent there that's not being spent on the wall either.
Well, Niels, appreciate the information. We'll keep following you on Twitter at Niels Lesniewski. And, of course, you're reporting at rollcall.com. Thanks so much.
Thank you.
The Senate Health Committee heard from an 18-year-old who got vaccinated against his parents' wishes. The committee's looking into vaccine safety and what to do about preventable outbreaks. The hearing is an hour and 50 minutes.
The Senate Committee on Health, Education, Labor, and Pensions will please come to order. Senator Murray and I will each have an opening statement, and then we'll introduce the witnesses. After the witnesses' testimony, senators will each have 5 minutes of questions. It wasn't long ago when I was a boy that I remember the terror in the hearts of parents that their children might contract polio. I had classmates who lived in iron lungs. The Majority Leader of the United States Senate, Mitch McConnell, contracted polio when he was very young. He has a poignant story about his mother didn't know what to do, but she took him to Warm Springs because that's where President Roosevelt went. And for a long period of time, when he was 2 and 3 years old, she massaged his legs several hours a day, which is hard to imagine if you remember toddlers. And that's why he's able to walk today. Thousands of others are not so lucky. Following the introduction of a vaccine in 1955, polio was eliminated in the United States in 1979, and since then from every country in the world except 3. Polio is just one of the diseases we have eradicated in the United States thanks to vaccine. Before the vaccine for measles was developed, up to 4 million Americans each year contracted the highly contagious airborne virus. In 2000, the Centers for Disease Control and Prevention, CDC, declared measles eliminated from the United States. In the 1980s, smallpox was declared eradicated from the world by the CDC and the World Health Organization. These stories of polio and measles and smallpox are a remarkable demonstration of what modern medicine can accomplish in the lives of millions of people in our country and in the world. 4 years ago, this committee held a hearing on vaccines. That was following the 2014 outbreak of measles, the worst outbreak since the disease was declared eliminated in 2000. And even though 91% of Americans had been vaccinated for measles in 2017, according to the CDC, we continue to see outbreaks of this preventable disease because there are pockets in the United States that have low vaccination rates. Last year, there were 372 cases of measles, the second highest number since 2000. So far this year, there have been 159 cases reported and outbreaks confirmed in Washington State, New York, Texas, and Illinois. We know some Americans are hesitant about vaccines. So today I want to stress the importance of vaccines. Not only has the Food and Drug Administration found them to be safe, but vaccines save lives. Vaccines have been so successful that until recently, Americans have lived without fear of getting measles, polio, or rubella. We've made significant strides in improving vaccination rates. In 2009, about 44% of Americans had received vaccines for 7 preventable diseases, all of which I'll now try to pronounce: diphtheria, tetanus, pertussis, polio, measles, mumps and rubella, Haemophilus, influenza type B, hepatitis B, chickenpox, and pneumococcal, according to the CDC. Today, over 70% of Americans are vaccinated against all 7 of these diseases. Vaccines protect not only those who've been vaccinated, but the larger community. This is called herd immunity. There are some young people who cannot be vaccinated. They're too young, or they have a weak immune system because of a genetic disorder, or they're taking medicine that compromises their immune system, like cancer treatment. Vaccines protect those who cannot be vaccinated by preventing the spread of disease. However, low immunization rates can destroy a community's herd immunity. While the overall vaccination rate nationwide is high enough to create this herd immunity, certain areas, the pockets of the country where vaccination rates are low, are vulnerable to outbreaks. There's a lot of misleading and incorrect information about vaccines that circulates online throughout social media. Here's what I'd like for parents in Tennessee to know, parents in Washington, parents in Texas, everywhere in the country. Vaccines are approved by the Food and Drug Administration. They meet the Food and Drug Administration's gold standard of safety. The Advisory Committee on Immunization Practices makes recommendations on the use of vaccines in our country, and annual child and adult vaccine schedules. This advisory committee is made up of medical doctors and public health professionals from medical schools, hospitals, and professional medical organizations from around the country. They're among the best our country has to offer. They have dedicated their lives to helping others. These recommendations are reviewed and approved by the CDC director and are available on the CDC website. There's nothing secret about any of this science, and countless studies have shown that vaccines are safe. Internet fraudsters who claim that vaccines are not safe are preying on the unfounded fears and daily struggles of parents, and they're creating a public health hazard that is entirely preventable. It's important for those who have questions about vaccines, especially parents, to speak with a reputable health provider. As with many topics, just because you found it on the Internet doesn't mean that it's true. The science is sound. Vaccines save lives, the lives of those who receive vaccines, and the lives of those who are too young or vulnerable to be immunized. Before I turn this over to Senator Murray, I want to add that the National Child Vaccine Injury Act of 1986 required the Department of Health and Human Services to submit a report to Congress within 2 years after the legislation was signed into law. The HELP Committee has received 2 reports from the Department submitted to Congress May 4, 1988 and July 21, 1989. I ask consent that the reports be submitted to the committee record so they can be more accessible to the public. Senator Murray.
Thank you very much, Mr. Chairman. As Washington State and several other states grapple with measles outbreaks, this issue could not be more timely. I remember in 2000 when measles was officially eliminated from the United States, and what welcome news that was for families across this country. And I remember the years of efforts that actually led to that victory. Before the vaccine was available, measles outbreaks used to spread through communities like wildfire. If you were old enough to drive, odds were you'd already had measles. But today, vaccines that protect against measles have been in use for over 50 years. Like other vaccines, we know the vaccine is safe, it's effective, and it saves lives. Which is why today a generation of students are starting college, almost none of whom had to worry about a measles outbreak at school. It also means a generation of new parents may not appreciate just how dangerous measles is. Before introduction of the measles vaccine and widespread vaccination, millions of people caught measles annually, meaning thousands were hospitalized, hundreds of people died, mostly children under 5 years old. But measles isn't just deadly. It's also one of the world's most contagious diseases. It is easily transmitted through coughing and sneezing. It can linger in the air and on infected surfaces for 2 hours. It is already contagious 4 days before an infected person develops a rash, and then another 4 days after. 9 out of 10 unvaccinated people exposed to measles catch it. That's why the measles vaccine is so important in providing protection. Experts say in order to establish herd immunity against measles, in order to prevent an outbreak from occurring within a community, at least 95% of people should be vaccinated. Meeting that threshold is crucial to protect people who are unable to get vaccinated, infants, those with certain medical conditions. Unfortunately, while the national vaccination rate remains high, in communities across the country, we are falling behind. Vaccine coverage rates are declining in certain areas, contributing to the rise in preventable outbreaks, like in Clark County, Washington, where public health officials continue to respond to a measles outbreak. The immunization rate among children in that community is less than 70%, far below what is needed to keep families safe. The result is a true public health emergency, over 70 confirmed cases and counting, and the majority of cases have affected children under 10 years old who are unvaccinated. Each case isn't just a concern for family members who are worried about their loved ones who are seriously sick. It is a threat to neighbors and communities left struggling to get an incredibly contagious disease under control. It's a terror for parents with newborns who cannot yet get vaccinated, and a strain on our public health system as hundreds of staff in Washington State are pulled from critical public health roles to respond to this crisis. And the Centers for Disease Control and Prevention stretches to support the response to outbreaks in Washington and several other states. Measles isn't the only disease that deserves our attention amid slipping vaccination rates. Diseases like the chairman mentioned, mumps, pertussis, or whooping cough are also cause for concern. These outbreaks are a clear sign we've had to do more to address vaccine hesitancy and make sure parents have the facts they need to understand the science. Vaccines are safe and effective and life-saving. Parents across the country want to do what is best for their families to keep them safe, which is why they need to be armed with knowledge about the importance of vaccination, and why we need research into vaccine communication tools and strategies to help us better educate people to address vaccine hesitancy and build vaccine confidence. We also need to understand the roles social media and online misinformation play in spreading dangerous rumors and falsehoods. And we need to better prepare the full spectrum of healthcare providers, who are often the professionals people trust most, to counter vaccine hesitancy and promote vaccination. That's important not only for parents, but also for expectant parents who may already be deciding whether or not they plan to vaccinate, and for promoting adult vaccines and encouraging people to protect themselves and others throughout their lives. I look forward today to hearing from Dr. Weissman about how Washington State is working now to get parents reliable information about the importance of vaccination, and from all of our witnesses who are here today about how the federal government and other partners can promote vaccines and prevent the spread of misinformation. And while we are now fighting multiple measles outbreaks, it's important we also educate people on the HPV vaccine's role in preventing sexually transmitted diseases and lowering cancer risks, the flu vaccine, particularly on the heels of one of the most deadly flu seasons in years, the whooping cough vaccine, especially for those around infants who are particularly susceptible to the disease, and the value of other recommended vaccines. We also need to make sure we are approaching the public health challenges like this from a global perspective, because we know diseases are not stopped by borders or walls or bans. They are stopped by doctors and nurses and vaccines and public health awareness. And they're stopped by strong investments in public health systems here at home and abroad. They say an ounce of prevention is worth a pound of cure. That's certainly the case here. A dose of MMR vaccine covering measles, mumps, and rubella is about $20. Meanwhile, Washington State has spent over $1 million already addressing the current measles outbreak. Investing in prevention isn't just more effective at keeping our families and communities healthy, it is more affordable as well. The Vaccines for Children program is another great example of this. Over 25 years now, it has helped kids in low-income families get shots at no cost. It has saved $1.6 trillion, prevented 380 million illnesses, and saved 860,000 lives. That's more people than live in Seattle. So I hope we can work together in a bipartisan way to build on programs like this with strong steps to help address public health crises, and better yet, to prevent them from happening in the first place. And I'm glad to have this opportunity to learn more about how we can do that, and to consider how to make sure people across the country understand that vaccines are safe and effective to keep their families and their community healthy. And, Mr. Chairman, I would ask that a letter from the National Association of County and City Health Officials be submitted for the record. It speaks to the important role of our local health departments across the country in responding to vaccine-preventable disease outbreaks and other emergency health threats.
So ordered. Thank you, Senator Murray. We'll now introduce our witnesses. Each one of you will have up to 5 minutes for questions and answers. I'll ask the senators, let's try to keep the questions and answers within the 5-minute period of time so everyone can have a chance to participate. Senator Murray will introduce the first witness.
Well, thank you again, Mr. Chairman. From my home state of Washington, I'm very pleased to introduce Dr. John Weissman. Dr. Weissman was appointed as Washington State Secretary of Health back in 2013, and his service there is just the latest in a 22-year career working to keep our families and communities healthy. Throughout his career, he's worked at 4 different health departments, including Clark County Public Health in Vancouver, which is the current front line of our measles outbreak in our state. And Dr. Weissman, I know some of my colleagues on the committee will appreciate learning that before you came to my state to work in our public health system, you got your education in theirs, receiving your bachelor's degree in Wisconsin, your master's in Connecticut, and your PhD in North Carolina. I'm glad we have you now in Washington State, working to help keep our families safe and healthy and respond to public health threats as we currently are. And I appreciate so much you coming out all the way out here from our other Washington.
Thank you, Senator Murray. Senator Isaacson, will you introduce our second witness?
Thank you very much, Chairman Alexander. I'm very pleased to introduce to the committee and everyone here today Dr. Saad Omer, and I believe that's the right pronunciation. Close enough. Good. Well, mine's Isaacson, so I just want to make sure we got it right. We're very delighted to have him here today as an expert on the subject we're discussing. Dr. Omer is William H. Fogge Professor of Global Health and Professor of Epidemiology and Pediatrics at Emory University, School of Public Health and Medicine. Dr. Omer also works in the Emory Vaccine Center, making him a well-qualified witness for today's hearing. His research includes studies in the United States and internationally, including clinical and field trials to estimate the efficacy of influenza, polio, measles, and other vaccinations. Dr. Omer has published approximately 250 papers in peer-reviewed journals and has served on several respected advisory committees and panels, including the U.S. National Vaccine Advisory Committee. He has also mentored over 100 junior faculty members, clinical and research postdoctoral fellows, and PhD and other graduate students, playing an important role in ensuring that the pipeline of qualified scientists is well stocked in the United States of America. Dr. Omer, welcome to the committee today. We're here for your expertise. We appreciate your testimony, and go Emory.
Thank you, Senator Isaacson. Third, we'll hear from Dr. Jonathan McCullers. He's chair of the Department of Pediatrics at the University of Tennessee Health Science Center, serves as pediatrician-in-chief at the remarkable Le Bonheur Children's Hospital in Memphis, received his medical degree and completed his internship and residency at the University of Alabama at Birmingham. In 1999, he was named a St. Jude Scholar in the Physician Scientist Development Program and joined the St. Jude faculty in the Department of Infectious Diseases, where he spent 13 years managing a translational research lab studying influenza viruses and bacterial pneumonia. In 2012, he joined Le Bonheur. He's published more than 150 peer-review articles. Fourth, John Boyle. He's president and CEO of the Immune Deficiency Foundation in Towson, Maryland, which is focused on meeting the needs of people with primary immunodeficiency disease. Prior to joining the foundation, he worked for the Children's National Medical Center and the Platelet Disorders Support Association. He received his Bachelor of Science from Boston University, a Master in Nonprofit Management from Notre Dame of Maryland University. Finally, we welcome Ethan Lindenberger. Mr. Lindenberger is currently a student at Norwalk High School in Norwalk, Ohio. He's here to share his experience seeking out information about vaccines and making decisions about whether or not to become vaccinated. Welcome again to all our witnesses. Dr. Wiseman, let's begin with you.
Great. Chairman Alexander.
Dr. Wiseman, excuse me.
Very good. That's good. Chairman Alexander, Ranking Member Murray, and distinguished members of the committee, thank you for the opportunity to discuss public health's work in protecting people from vaccine-preventable diseases. Vaccines are safe, effective, and the best protection we have against serious preventable diseases like measles. Vaccinating children in the United States has saved millions of lives, increased expectancy, and saved our society trillions of dollars. My mission as Washington's Secretary of Health is to protect and promote the health of all its people and ensure our public policy is based on best available science. I want to speak directly to the parents who have children with serious health issues and who have been attending our hearings in Washington State and are watching this hearing today. I see your pain and your desire for answers to your children's health issues. Your mission to protect and promote the health of your children is one we share. While the science is clear that vaccines do not cause autism, we do need to better understand its causes. We need to develop together, affected families, scientists, and public health officials, research agendas to get the answers we need. State, territorial, and tribal local public health agencies are on the front lines. In Washington State, we provide all recommended vaccines without charge to all children under the age of 19. We provide an electronic immunization information system for healthcare providers to track vaccine dose schedules, provide reminders when patients are overdue, and measure immunization rates. We help parents make informed decisions by sending them the information they need to keep children healthy and publish plain talk about childhood immunization. And we assist school nurses by giving them access to the electronic immunization records. As of yesterday, Washington State's measles outbreak had 71 cases, plus 4 cases associated with our outbreak in Oregon and 1 in Georgia. Containing a measles outbreak takes a whole community response, led by governmental public health. The moment a suspected case is reported, disease investigators interview that person to determine when they were infectious, who they were in close contact with, and what public spaces they visited. If still infectious, the health officer orders them to isolate themselves so they don't infect others, notifies the public and about the community about the public places that they were in when they were infectious, and stands up a call center to handle questions. We also reach out to individuals who were in close contact with the patient. If they are unvaccinated and without symptoms, we ask them to quarantine themselves for up to 21 days. That's how long it can take to develop symptoms. And we monitor them so that we quickly know if they develop measles. If they show symptoms, we get them to a healthcare provider and obtain samples to test for measles. And if they have measles, we start the investigation process all over again. This is a staff and time-intensive activity and is highly disruptive to people's lives. Responding to this preventable outbreak has cost over $1 million and required the work of more than 200 individuals. So what do we need from the federal government? First, we need sustained, predictable, and increased federal funding. Congress must prioritize public health and support the Prevention and Public Health Fund. We are constantly reacting to crises rather than working to prevent them. The Association of State and Territorial Health Officials and over 80 organizations are asking you to raise the CDC budget by 22% by FY22. This will immediately bolster prevention services and reduce health care costs. Preparedness programs authorized by this law are currently funded $400 million below funding levels in the 2000s. More robust funding is needed, and I strongly urge you to quickly reauthorize POPRA because many of the authorizations expired last year. Third, the 317 immunization program has been flat funded for 10 years. Without increased funding, we cannot afford to develop new ways to reach parents with immunization information nor maintain our electronic immunization systems. Fourth, we need federal leadership for a national vaccine campaign spearheaded by CDC in partnership with states that counter the anti-vaccine messages, similar to the successful Truth Tobacco Prevention campaign. We have lost much ground. Urgent action is necessary. Everyone has a right to live in a community free of vaccine-preventable diseases. To make this a reality, we must continue to invest in and strengthen our public health system. Thank you.
Thank you, Dr. Weisman. Dr. Omer.
Thanks for the opportunity for me to talk about vaccines in this forum. Elimination of endemic measles transmission from the U.S. in 2000 is a significant public health success. Since then, most of the cases have occurred through U.S. travelers going outside and bringing it back. While recent measles outbreaks have been contained, the frequency and size of these outbreaks have been particularly alarming for those of us who follow these trends. The rest of this testimony will be focused on answering some of the salient questions that have been coming up. So the first question is, why haven't we seen a national level outbreak in the U.S.? And we cannot take this for granted. Our countries with similar development status, like Germany, France, and Italy, specifically more recently, have had national level outbreaks. And it is not a coincidence that we haven't seen similar national outbreaks, and there are several reasons for it. First of all, our laws, school-level mandates work, and they work by changing the balance of convenience. In most states, they work by changing the balance of convenience for vaccination compared to non-vaccination, by having physician counseling, or by having parents go through a video that talks about vaccines and the benefits of vaccines, etc. And the third thing is, in our country, medical societies like the American Academy of Pediatrics and the Infectious Disease Society of America have been very prominent in vaccine advocacy. And it is important because it's based on the fact that physicians are the most trusted source of vaccine information. So we have talked about the role measles has played in vaccine refusal has played in these outbreaks, and I will just give a few numbers. For example, more than half of the cases since the elimination have been unvaccinated, and approximately 70% of them are unvaccinated due to vaccine refusal or non-medical exemptions. So there is a contribution of vaccine refusal in our epidemiology of measles. And vaccine mandates have been an effective tool in changing that balance of convenience that I was talking about. But that's a state-level issue. I will focus on some of the things the federal government can do. In my written testimony, I have provided a few more details on that specific issue, and I'd be happy to answer questions. So there are a few things the federal government can do. First, consider making vaccine counseling reimbursable. And I have worked on vaccine research in multiple countries and multiple states in the U.S. There are a lot of local factors that are specific, but there's one constant. Healthcare providers, specifically physicians, are the most trusted source of vaccine information, even amongst those who are a little bit skeptical of vaccines. So we need to use that tool more effectively. On the practical side, physicians do not have the time to properly counsel patients using evidence-based approaches. And part of the reason, not all of the reason, is the fact that this is not reimbursable. So physicians lose money on this kind of important public health education. We should, as a country, the second point is invest in high-quality vaccine acceptance and communications research. And I often say that if we don't accept half-baked vaccine development science, and we don't. The FDA goes through evaluation of the science from trials and basic sciences, etc. We should not be accepting of half-baked vaccine communications and behavioral science. And we have precedent in this country. For example, NIH's cancer prevention initiatives are a gold standard in these kinds of interventions and evidence-based communication strategies. NIAIDs, the National Institute for Immunology and National Institute for Infection and Allergy they have had very effective intervention development in the area of HIV/AIDS behavior. So we have that precedent in this country, and we need to invest in actual research. And before we develop evidence, while we develop evidence, there is an existing blueprint of interventions that the National Vaccine Advisory Committee put together. And unfortunately, not all of its interventions and its recommendations have been implemented. So that is ready to be implemented. And CDC plays this important role in fighting these fires, working with state and local health departments, which is somewhat unique in the developed world, so we need to support their mission. And we should continue to prioritize vaccine safety research, and I would want to thank you for bipartisan and consistent support for vaccines, because that matters. And that shows that there is broad societal support for vaccines. And those of us who work to protect children from these infectious diseases really appreciate that.
Thank you, Dr. Omer. Dr. McCullers, welcome.
Thank you. Good morning, Chairman Alexander, Ranking Member Murray, other members of the committee. My name is John McCullers. I'm the Chair of Pediatrics at the University of Tennessee and the Pediatrician-in-Chief at Le Bonheur Children's Hospital in Memphis. As someone who has devoted his career to the child health sphere, I truly believe there's no more precious resource than our children, and they should be protected by all means available to us. They really are the future of this nation. The childhood vaccination program in the United States has proven to be one of the most powerful public health achievements in our history. In the first half of the 20th century, there were more than 1 million infections and more than 10,000 deaths every year in this country from diseases which are now preventable by childhood vaccines. Measles alone caused more than 500,000 illnesses every year. Measles is a highly contagious viral respiratory disease characterized by fever, cough, sore throat, and a rash. It is a very dangerous disease. About 1 in 1,000 infected persons develop encephalitis, an infection of the brain. 1 in 1,000 develop severe pneumonia, and about half of those with those severe complications die. There is no specific treatment for measles, so vaccination is the only means of preventing these outcomes. With the introduction of a safe and effective vaccine for measles in 1963 and improved public health efforts to see that nearly every child received it, new cases of measles arising in the United States were entirely eliminated by the year 2000. Unfortunately, the issues of vaccine opposition and vaccine hesitancy are now impairing our ability to effectively ensure coverage, aided by state laws that make it easier to avoid vaccination. The last decade has brought numerous outbreaks to the United States, including several that are ongoing at present. These outbreaks are strongly linked to vaccine refusal, and in particular to clustering of unvaccinated individuals in specific communities or regions. This problem is not limited to the United States, however. Countries worldwide are dealing with similar outbreaks. As a single example for the committee, there were 0 cases of measles in Brazil in 2017, but more than 10,000 cases occurred on a countrywide level in 2018 when infected travelers brought measles into that country. The vaccine against measles is very safe and very effective. 1 dose provides complete protection in about 93% of individuals, while a second dose raises that level of protection to 97%. Very few side effects occur. About 1 in 10 children experience fever for 1 to 2 days after vaccination, and about 1 in 3,000 to 1 in 4,000 have a simple seizure associated with fever with no lasting effects. Allergic reactions are very rare and typically very mild. When compared to the outcomes of the disease itself, it's easy to see why doctors and public health officials universally recommend on-time and complete vaccination. Unfortunately, vaccine refusal is high and getting worse in many states. This issue is complicated by the variety of state policies regarding exemption from vaccination and the methods of counseling about vaccines. The rate of parents claiming non-medical exemptions is about 2.5 times higher in states that allow both religious and philosophical objection. Evidence seeing that multiple pathways for exemption really worsens this problem. Social media is now driving a new phenomenon somewhat distinct from vaccine opposition, termed vaccine hesitancy. When parents get much of their information about health care issues such as vaccines from the internet or from social media platforms such as Twitter and Facebook, reading uninformed opinions in the absence of accurate information can lead to really understandable concern and confusion in these parents. They may be hesitant to get their children vaccinated without being provided with more information. The role of the pediatrician is very important, therefore, with these families. We must do a better job of communicating at many levels, but particularly at the point of contact at the well-child visit when vaccination should take place. About half of the time, when counseled appropriately, parents with vaccine hesitancy will agree to have their children vaccinated on time. And the other half, little seems to help at that stage, so the solution must be earlier, either in the form of policy or broader educational efforts. In closing, I'd like to thank the committee for addressing this important issue. Vaccine refusal is one of the growing public health threats of our time. If we continue to allow non-medical exemptions to vaccination, the rates of vaccine will continue to fall. More outbreaks will undoubtedly follow. As a leader at a children's hospital, I have a unique perspective on this, as children's hospitals are regional and sometimes national resources. LeBonheur Children's Hospital sits in the corner of Tennessee next to Arkansas and Mississippi. Three states all have very different policies for granting exemptions to vaccines, which creates a tremendous problem for us and a threat to the children we serve, many of whom are too young to be vaccinated or are immunocompromised and more prone to severe diseases. I urge the committee to consider solutions that will both harmonize public health policy in this area and will also protect children as they grow up to become the next generation. Thank you.
Thank you, Dr. McCullers. Mr. Boyle, welcome.
Chairman Alexander, Ranking Member Murray, and members of the committee. Thank you for inviting me here to testify on the importance of herd immunity, or community immunity, as we like to say, for vaccine-preventable diseases. My name is John Boyle, and I am the President and CEO of the Immune Deficiency Foundation, a not-for-profit patient organization that represents people with primary immunodeficiency diseases, or PI. Primary immunodeficiency diseases are a group of more than 350 rare and chronic disorders in which parts of the body's immune system are either missing or functioning improperly. There's an estimated 250,000 people diagnosed with PI in the U.S. alone. That's about 1 in 1,200 of your constituents. These disorders are caused by genetic defects and are not contagious. Now, there's a variety between the different forms of PI, but one thing unites all of us. We are immunocompromised, meaning that we are potentially vulnerable to even common viruses and bacteria. Now, I have a form of PI known as X-linked agammaglobulinemia, or XLA. I was diagnosed with it when I was 6 months old, when a respiratory infection nearly killed me. In short, I don't produce antibodies. But I'm able to be here with you today because I receive weekly infusions of antibodies from other people through a blood plasma product called immunoglobulin, or IG. These infusions give me back some of what I'm missing, but I'm still susceptible to infections. Now, because I was diagnosed early and I receive IG therapy, my health is better than most others with PI. However, a simple cold can wreak havoc with me or many other members of our community. We're incredibly vulnerable to communicable illnesses. Now, for some members of our community, infections are truly a life and death matter. I think all of you probably remember David Vetter, affectionately known as the boy in the plastic bubble, who was born with severe combined immune deficiency, or SCID. Children diagnosed with SCID, XLA, or any other form of PI face multiple challenges with simple everyday pathogens. Exposing these children to something as severe as measles could be life-threatening. Parents in communities where vaccine use is being questioned are afraid to send their children outside. They're afraid because they know the history, the science, and the math, and they know the stakes. If people stop vaccinating, the safety net of community immunity will fall, and their children will be among the first casualties. Now, of course, this does not just affect children, it affects adults too. While there's now newborn screening for SCID, most members of our community go years or even decades with serious and recurrent infections without knowing that they have a compromised immune system. And I'm particularly concerned for the health of this segment of our community, the undiagnosed. If community immunity fails, they don't even know that they need to take precautions. Those of us who know that we have PI do what we can to avoid exposure to infections, but the undiagnosed lack this basic knowledge and are even more at risk. Now, the reason that all of us are so dependent on community immunity and the PI community is that vaccines do not work with most of us who have forms of PI. Our systems either don't remember the pathogens or we physically can't create the antibodies. A further complication is that there are some vaccines that are actually dangerous to us, live vaccines. As a result, those in the field of immunology have studied this issue thoroughly to produce evidence-based guidelines to best safeguard those of us with PI. An article that I've shared with the committee discusses the issues surrounding which vaccines are either indicated or not, but it also addresses the growing neglect of societal adherence to routine vaccinations, what we're here talking about today. It states how important it is for family members and then those around patients with immunodeficiencies to receive all available standard immunizations in order to protect the family member who has PI. Now, in closing, let me say this. My life, along with the lives of hundreds of thousands of others who are immunocompromised, depend on community immunity. We depend on vaccines. I understand the concern that some new parents have, particularly given the misinformation on social media. But that fear can't override the facts. History has shown us that vaccines work. Science has shown us that vaccines are necessary. And mathematics has shown us that the odds of children having a healthy life are magnitudes greater if they've had their vaccines. The current decline in vaccine usage is literally bringing back plagues of the past. While those of us who are immunocompromised will suffer first and suffer more, the loss of community immunity is a threat to all of us. We need to band together to dispel the myths, combat misinformation campaigns, and help ensure that measles and other vaccine-preventable diseases are once again put in their place, in history books and not in our communities. Thank you.
Thank you, Mr. Boyle. Mr. Lindenberger, welcome.
Thank you, Chairman Alexander, Senator Murray, and distinguished committee members for the opportunity to speak today. Good morning, everyone. As was stated, my name is Ethan Lindenberger, and I'm a senior at Norwalk High School. And my mother is an anti-vax advocate that believes vaccines cause autism, brain damage, and do not benefit the health and safety society, despite the fact such opinions have been debunked numerous times by the scientific community. I went my entire life without numerous vaccines against diseases such as measles, chickenpox, or even polio. However, in December 2018, I began catching up on my missed immunizations, despite my mother's disapproval, eventually leading to this story and being able to speak here today, and I'm very happy for that, so thank you. Now, to understand why I've come here and what I really want to talk about, I have to share some details about my home life and my upbringing. I grew up understanding my mother's beliefs that vaccines are dangerous, and she would speak openly about these views. Both online and in person, she would voice her concerns, and these beliefs were met with strong criticism. Over the course of my life, seeds of doubts were planted and questions arose because of the backlash my mother would receive, but over time that really didn't lead anywhere. Now, it's important to understand that as I approached high school and began to critically think for myself, I saw that the information in defense of vaccines outweighed the concerns heavily. I began leading debate clubs in my school and pursuing truth above all else, and I realized one certain quality to debates and to conversations in general when it comes to controversial discussions, which is that there seems to always be two sides to a discussion. There always seems to be a counterclaim or rebuttal, and always something to strike back with in terms of debate. Though this may seem true in all instances, this is not true for the vaccine debate, and I approached my mother with this concern that she was incorrect. I approached my mother numerous times trying to explain that vaccines are safe and that my family should be vaccinated, approaching even with articles from the CDC, explicitly claiming that ideas that vaccines cause autism and extremely dangerous consequences were incorrect. In one such instance where I approached my mother with information from the CDC that claimed vaccines do not cause autism, she responded with, "That's what they want you to think." Skepticism and worry were taking the forefront in terms of information. Now, conversations like these reaffirm that evidence in defense of vaccines was, at least on an anecdotal level, much greater than the deeply rooted misinformation my mother interacted with. And that's what I want to focus on today. To combat preventable disease outbreaks, information is, in my mind, the forefront of this matter. My mother would turn to anti-vaccine groups online and on social media looking for her evidence in defense rather than health officials and through credible sources. This may seem to be in malice because of the dangers that not vaccinating imposes, but this is not the case. My mother came in a sense of loving her children and being concerned. This misinformation spreads, and that's not necessarily justifiable, but I carry this knowledge with me that it was with respect and love that I disagreed with my mother. And with the information she provided, I continued to try and explain that it was misinformed. Ideas that, again, vaccines cause autism, brain damage, and also that the measles outbreak is of no concern to the society and to America were ideas that were pushed by these sources that she would go to. And for certain individuals and organizations that spread this misinformation, they instill fear into the public for their own gain selfishly, and do so knowing that their information is incorrect. For my mother, her love, affection, and care as a parent was used to push an agenda to create a false distress. And these sources which spread misinformation should be the primary concern of the American people. Although change is already placed, more strides can be done. Almost 80% of people, according to the Pew Research Center, turn to the internet for health-related questions. I further explain some more statistics and evidence in my written testimony. Now, in terms of what I would like to walk away with today and kind of finalize with, although my mother would turn to very illegitimate sources and sources that did not have peer-reviewed evidence or information, I quickly saw that the evidence and claims for myself were not accurate. And because of that, and because of my healthcare professionals I was able to speak with and the information provided to me, I was able to make a clear, concise, and scientific decision. Approaching this issue with the concern of education and addressing misinformation properly can cause change, as it did for me. Now, although the debate around vaccines is not necessarily centered on information and concerns for health and safety, this is why education is important, and also misinformation is so dangerous. Thank you.
Thank you, Mr. Lindenberger, and thank you for coming from Ohio to let us hear what you have to say. Now we'll begin a 5-minute round of questions. We have many senators interested. I would ask the senators to keep the combination of questions and answers within 5 minutes. Dr. McCullers, you're a pediatrician in chief at one of our country's leading children's hospitals, so your business is to talk every day during your career with lots of parents about their children. So what do you say to parents, to a parent who comes to you in Memphis and said, I've heard on the internet or I've read that vaccines cause autism and I don't want my child to be vaccinated? What do you say to that parent?
Well, what we find when we look at this is that parents really have a very, complex set of issues that they're concerned about. That's one of them, but there's a lot of other things that they think about and that they bring to us. So it's not one issue that we have to talk about. It's
well, but
many,
what have
many
they?
issues.
I want to focus on autism.
On the autism.
What have they say that to you?
So this was a concern that was raised about 20 years ago when there was a fraudulent paper published linking vaccines to autism.
Now, that paper was published in the United Kingdom.
It was published in the United Kingdom.
In a respected journal, is that correct?
It was a respected journal. It was a physician who published it, and he was unfortunately paid by a set of attorneys more than £400,000 to falsify information because they were suing the government of England against vaccines. So this was found to be wrong. It was retracted. He lost his medical license.
What did the journal do about it?
The journal retracted the paper and said it no longer is valid.
Mm-hmm. Have there been other papers or journals that agreed with that physician's?
There have not been that agreed with that position. There have been numerous scientific research done in the interim that have shown the opposite, that these vaccines are not linked. And the Institute of Medicine here in the United States, our highest authority on these sort of issues, has declared that it's uniformly basically a closed issue now.
As you talk with parents, though, is that persuasive with a mother who's concerned about her child and who's heard that that vaccines cause autism?
I think if there is a rapport with the physician and a mutual respect there, both for the opinion of the parent, but then also for the position of the physician, you can say things like that and say the evidence is clear, I believe this, you should do this, and they will trust that information.
In your opinion, there's no evidence, reputable evidence, that vaccines cause autism?
There is absolutely no evidence at this time that vaccines cause autism.
Dr. Omer, do you agree with that?
Absolutely.
Dr. Weisman, do you agree with that?
I do.
Mr. Boyle, do you agree with that?
I do.
Mr. Lindenberger?
I do.
Dr. Weisman, what about state exemptions? You're a state public health officer, and as a former governor, I generally have a bias toward Washington not telling states what to do on many, except Washington. With Washington, D.C. not telling states what to do. Senator Murray is correcting me here. So what advice do you have about state exemptions and the effect on the concern we see today in pockets of measles across the country?
I think, as we heard earlier, that the choice to sort of make exemptions more difficult to get, to be sort of as burdensome as sort of not getting the vaccine is incredibly important. In Washington State, as you know, we have 2 bills right now that are looking to remove the personal exemptions from vaccine for school entry and for child care entry. I think that's one of the tools that we have and that we should be using for this. I will also say in Washington State, another problem we have is that about 8% of our kids are out of compliance with school records, so that we don't even know if they're vaccinated or would like exemptions. And we have to tackle that problem as well, which really is a resource issue for schools and public health.
I'm going to stay within my time. Senator Murray.
Thank you very much. Dr. Weisman, I really appreciate everything you and your state and local colleagues are doing on the front lines of this measles outbreak in Washington State, confirming and managing the cases, tracing potential contacts, identifying exposure sites, crafting community messages. There's a lot going on, but it is really scary to imagine how much worse this outbreak would be if not for all the tireless work of so many public health officials on the ground. But we all hope we are able to not just respond to outbreaks, but also focus on preventing them in the first place. Mm-hmm. And I wanted to ask you, how have initiatives like the public-private partnership, Vax Northwest, and your department's proactive communication with parents of young children helped in building confidence?
Great, thanks. Yes, we do believe that the child profile mailings that go out to parents, to kids up to age 6, they go out at points in time that are appropriate to the development of the child, are incredibly important. It's a trusted source of information, not just on vaccines, but on childhood development. And it's that relationship that we build with parents through that mailing that I think is incredibly important. When I go out to the public and I see a new parent, I'll often ask them, hey, do you get this little mailing from, the health department? And they say, we love it, it's great information. So I think that trusted source is really important. The public-private partnership that we have with Vax Northwest is actually a research initiative to try and best understand how we actually address vaccine hesitancy. There have been 2 studies done, one looking with healthcare providers on how to best train them around communication with their patients. Unfortunately, that work didn't find that it made a difference in terms of addressing vaccine hesitancy, nor necessarily healthcare providers' efficacy around feeling confident in those conversations. The other piece was one with parents, and parents who were interested in vaccine advocacy, training them on how to have conversations with parents, how to share information at PTA meetings, et cetera. And that did find that it increased parents' knowledge of vaccines and reduced their hesitancy.
Okay, thank you. And Dr. Omer, as vaccination rates in some areas drop below levels we need to keep each other safe, your research on vaccine hesitancy and likewise is really critical. And we know that some parents are making decisions about whether or not to vaccinate before they even have their child. I wanted to ask you, what are the implications of some of these early decisions, and what have you learned about the key factors that lead some parents to hesitate to vaccinate?
Thank you for the question. And you rightly pointed out that there's evidence to suggest that a lot of parents are making the decisions around vaccines before the baby is born. After the baby is born, it's like a fast-moving train, and parents go through this extended jet lag. And so before that, there's a lot of discussion happening, et cetera. And there are several reasons for this. The first one is, the big picture reason is that vaccines are a victim of their own success. And as the rates of vaccine-preventable diseases go down because of vaccines, successive cohorts of parents see and hear about real or perceived adverse events and not the disease. And what happens is that mental calculus changes. And in that milieu, they interact with several local factors. And in the US, for example, we have, due to that sort of change in the disease rates, which is a good thing, we have less appreciation of vaccine susceptibility and severity and more questions about vaccine safety. Yeah. And so in that context, focusing on not just childhood, but before the baby is born, we are working, for example, our group is doing a randomized controlled trial in collaboration with the University of Colorado and Johns Hopkins, where we are, and this is due to the investment, due to funding from the National Institute for Allergy and Infectious Diseases, where we're looking at bringing together the best evidence and packaging it and seeing if that has an impact, not just maternal vaccination, but this intervention being performed in pregnancy leading to childhood vaccination rates increase. And so the initial results from them are promising, but to come back to the idea that we need to continue to invest in the best science for vaccine behavior and communication as we do for vaccine safety and vaccine efficacy.
Okay, thank you very much. Thanks.
Thank you, Senator Murray. Senator Isaacson.
Thank you, Chairman Alexander. Thank you all for your testimony. Mr. Lindenberger, what year in school are you?
I am a senior in high school.
When did you start doing the investigation and research on vaccination?
So for my mother specifically, I mean, she would vocalize her views on vaccines throughout my entire life, and it was a slow progression to start to see evidence as I would see people, I suppose, try and counterclaim with her and argue online. I would see that she would have this backlash as she would share information. So on Facebook, she'd share a video, and people would be like, that's incorrect, this is false. And so as a child, that intrigued me, that people disagree with my mom, and I slowly looked into it over the course of multiple years.
That's the second time you've used online in your answer. I want to add, did your mother get most of her information online?
From what she's presented, yes, either through Facebook or through sites that use the social media platforms like Facebook and other, mainly Facebook. I mean,
where do you get most of your information?
From not Facebook. I mean, from CDC, the World Health Organization, scientific journals, and also cited information from those organizations like the Institute of Medicine. Trying my best to also look at accredited sources.
I'd love to be a guest at Thanksgiving dinner at your house. That would be a heck of a discussion everybody would have. I know that. Dr. Omar, thank you for being here, and thanks for the work that Emory does. Emory does a phenomenal job in infectious diseases and all kinds of things like that. What currently, are there any things on the horizon that would join this group of people that we might want to be immunized for later on?
So there's several exciting developments, and one of the big gaps in vaccine has been the fact that there is a gap of vulnerability between the baby is born and when we start vaccinating them. And that's due to immunological reasons. And one of the more exciting developments in this area is the area of maternal immunization, where you vaccinate mom, and I had the privilege of being involved with some of those trials, et cetera, to protect not just the mother, but the baby as well. So there are vaccines against the respiratory syncytial virus, which is the biggest cause of viral pneumonia in the world, that are on the horizon. So there's a variety of vaccines being developed. There is a vaccine that is being developed against group B streptococcus, et cetera. So there are several vaccines on the horizon. The field is expanding.
Now, would those vaccinations take place in the mother before the baby is delivered?
Yes.
So it transfer to the baby during the course of gestation?
Yeah, exactly. And our first trial was had a name of Mother's Gift ages ago, and I think it's an appropriate name for this kind of a strategy where maternal antibodies protect the baby.
You know, I've been to Africa with CDC a number of times and seen your work, the work in the field that they do. I don't know of any organization that does more for health care in our country than CDC does. How much do you use CDC for as a resource in your work at Emory?
A lot. So CDC is a national treasure. And the firefighting function that I talked about, they perform with the state and local health department, is somewhat unique. For example, the European CDC is relatively new and has a very narrow mandate. And people who have looked at the effectiveness of national public health agencies in Europe have clearly come out with the understanding that our CDC is very strong, and I'm not trying to put down any other country's public health agencies because, you know, they are trying their best, but the kind of investments that have gone into building this cooperative framework of the CDC being the premier technical public health agency, but working closely with the state and local health department has served us really well, including in this area.
I don't think you're putting them down at all. In fact, to tell you the truth, it's the world's healthcare center at CDC, and we are lucky to have it in the United States of America. But the world considers it their health center, and they're doing a better job. CDC is doing a better job incubating CDCs in other countries now to replicate what they do in countries that are more developed and populated. So they're a great resource, great help, and great service. And I thank all of you for being here today. And Ms. Lindbergh, don't forget, I'd love to come to Thanksgiving dinner one day and just meet you in your mom. Thank you, Mr. Chairman, or Madam Chairman.
Senator Baldwin.
Thank you. In 2015, this committee held a similar hearing to discuss the resurgence of vaccine-preventable diseases in response to a multi-state measles outbreak. Our nation's vaccination program has saved lives by preventing and reducing the outbreak of vaccine-preventable diseases like measles, which has one of the most effective vaccines. So I am troubled that we are here again facing another preventable outbreak in several states that has similarly been exacerbated by a surge of misinformation surrounding vaccine safety. I believe we must do a better job to prioritize investments in cutting-edge science and public education surrounding vaccine safety. Younger children and those with compromised immune systems have a higher risk of measles complications, and with the breadth of misinformation proliferating in the media and online about the science behind vaccines, Dr. Weissman and Dr. Is it Omer?
Yes.
Omer, what role do state health departments play in arming community leaders like school officials and providers with accurate information and scientific resources on vaccine safety? And as a follow-on, what can Congress do to improve the public health education so we don't see another preventable outbreak in the future?
Thank you for that question. Yes, so states and local health departments really are the leaders in communities around these health strategies to engage their communities around vaccine information. They help provide the health education. They work with the school systems. They work with healthcare providers to make sure that healthcare providers have the information they need. It really takes a sort of coordinated effort. And honestly, you know, that system's crumbling. The sort of resources that are going into prevention in our state, local, tribal, and territorial health agencies has been decreasing. And we're really not up to the task. For example, you know, I had a call with CDC a number of months ago. State health officials, we do this every 2 weeks, and CDC was on the call talking about a hepatitis A outbreak that's occurring throughout the country in many communities. They're encouraging us to do proactive vaccination campaigns with homeless and injection drug users, which is where this is being sought or being seen. Mm-hmm. I don't have the resources. I asked my staff, what would a plan look like that? It would probably cost us $5 million. I don't have those resources. I don't have the staff that are there. That's very, very concerning to me. And I forgot your second question, but
how can Congress help? So I think you may have
sort of helped answer that right
That's
there.
Right. That's right.
Including, I think, investing in research around how do we, the social research around how is it we communicate with folks about vaccines and then have a national campaign. We really need to get on this.
So yeah, just to add to that, in addition to research and investment in high-quality research, I think the Congress can work on making vaccine counseling reimbursable. So that's a specific tool that physicians can use at the periphery, at the front lines of these conversations that are happening every day. Then sort of take the blueprint that I mentioned that is already there, that was developed by the National Vaccine Advisory Committee, that has very specific science-based recommendations to have that kind of implementation out there, and to continue to support CDC's mission of these controlling outbreaks, etc. That shouldn't be taken for granted. And the last thing in this stream of specific things is continue to prioritize the vaccine safety research enterprise that we have, which is not just a template for this country, but everywhere else as well. So having a robust vaccine safety system is not only a tool to maintain confidence in vaccines, but it's just the right thing to do. So these are some of the specific things Congress and the federal government can do.
Thank you. I have only a few seconds left. I'm going to ask a question. Maybe if we run out of time, you can submit information for the record. But I follow, of course, some of the advancements that happen in my state and some of the interesting things that are happening. Since 2007, a company called FluGen in Madison, Wisconsin, has been working to develop a more effective flu vaccine based on technology that was discovered and invented at the University of Wisconsin. As we've heard today, highly effective vaccines have played a critical role in advancing public health around the world. And I think there's more that we can do to develop, to support the development of better vaccines to protect individuals from an illness that results in literally thousands of deaths each year. Mr. Boyle, can you describe why it's important for Congress to continue to support this medical research that advances the development of more effective vaccines for common illnesses like the flu and specifically for vulnerable populations?
Sure, let me try. One of the challenges that I see when I even think about my colleagues and friends who sometimes struggle with whether to get the flu vaccine is basic issues of fears of things like needles. They don't want to get a shot. They're scared of that. For that reason, I know that things like the flu mist and others are attractive. The problem is, within our community, a live virus, such as that has been used in the past, is a problem. So we are a little bit torn in that, we want something to be easy and efficacious and something that's going to be widely adopted. But at the same time, we have to be concerned about those who are especially undiagnosed. So there is a little bit of a balance there, and further investigation to help understand what new technologies could be made to reduce the burden of getting a vaccine, be it for the flu or anything more communicable, would be phenomenal. At the same time, we'll have to work with the CDC and others in order to balance out the needs of those who are actually going to be affected by that negatively. But we're all in it together, so the continued conversation and exploration is important. And we, our community and other immunocompromised communities would, I think, be delighted to be part of those conversations.
Thank you.
Dr. Paul.
Thank you. Thank you for your testimony. For much of modern history, science and freedom have lived in relative harmony. Traditionally, as medical discoveries came about, like the smallpox or polio vaccine, antisepsis or antibiotics, the results were so overwhelming that over time the vast majority of the public accepted these advances voluntarily. In fact, innovations like the smallpox vaccine had to overcome initially great public prejudice. Dr. Zebediah Boylston learned about the Middle Eastern technique from his servant for the famous pastor, Cotton Mathers. His first patient was actually his son, an incredibly brave choice. The consensus of the medical community, though, was entirely opposed to him at the time. The vaccine was a live vaccine, and as Dr. Boylston learned, about 1 in 50 of those inoculated would die from the vaccine. And yet, the death rate from smallpox was approximately 50%. The government did not mandate the vaccine, though, but within 2 generations it was accepted enough that George Washington insisted that Martha be vaccinated with the smallpox vaccine before visiting him in the military camps. Today, though, instead of persuasion, many governments have taken to mandating a whole host of vaccines, including vaccines for non-lethal diseases. Sometimes these vaccine mandates have run amok when the government mandated a rotavirus vaccine that was later recalled because it was causing intestinal blockage in children. I'm not a fan of government coercion, yet given the choice, I do believe that the benefits of most vaccines vastly outweigh the risks. Yet it is wrong to say that there are no risks to vaccines. Even the government admits that children are sometimes injured by vaccines. Since 1988, over $4 billion has been paid out from the Vaccine Injury Compensation Program. Despite the government admitting to and paying $4 billion for vaccine injuries, no informed consent is used or required when you vaccinate your child. This may be the only medical procedure in today's medical world where an informed consent is not required. Now, proponents of mandatory government vaccination argue that parents who refuse to vaccinate their children risk spreading these diseases to the immunocompromised community. There doesn't seem to be enough evidence of this happening to be recorded as a statistic, but it could happen. But if the fear of this is valid, are we to find that next we'll be mandating flu vaccines? Between 12 and 56,000 people die from the flu, or are said to die from the flu in America, and there's estimated to be a few hundred from measles. So I would guess that those who want to mandate measles will be after us on the flu next. Yet the current science only allows for educated guessing when it comes to the flu vaccine. Each year, before that year's flu vaccine or strain is known, the scientists put their best guess into that year's vaccine. Some years it's completely wrong. We vaccinate for the wrong strain of flu vaccine. Yet 5 states already mandate flu vaccines. Is it really appropriate to mandate a vaccine that more often than not vaccinates for the wrong flu strain? As we contemplate forcing parents to choose this or that vaccine, I think it's important to remember that force is not consistent with the American story, nor is force consistent with the liberty our forefathers sought when they came to America. I don't think you have to have one or the other, though. I'm not here to say don't vaccinate your kids. If this hearing is for persuasion, I'm all for the persuasion. I vaccinated myself. I vaccinated my kids. For myself and my children, I believe that the benefits of vaccines greatly outweigh the risks. But I still do not favor giving up on liberty for a false sense of security. Thank you.
Do you yield back? Senator Ward.
Thank you, Mr. Chairman. So we've heard today about how important vaccines are to preventing and controlling many diseases. And I want to zero in on one that we are battling right now in Massachusetts. Since last April, 318 outbreak-associated cases of acute hepatitis A virus have been reported in the Commonwealth of Massachusetts. Hep A is a contagious virus that causes liver infection. Older children and adults who acquire the hepatitis A virus can experience a slew of incredibly unpleasant symptoms, fever, nausea, and in rare cases, the virus can even lead to death. In Massachusetts, 4 people have already died since the outbreak began. Now, we didn't used to have a hepatitis A vaccine at all. But in 1995 and 96, the Food and Drug Administration approved 2 hepatitis A vaccines, and soon after, CDC recommended vaccination for certain populations, including routine vaccinations of children living in areas with elevated rates of the virus. Dr. McCullers, you study infectious diseases. What impact did the introduction of the hepatitis A vaccine have on the national rates of the virus?
Well, thank you very much, Senator Warren. Yes, hepatitis A can be a very severe disease, in particular high-risk groups. The vaccine that came out in the late 1990s is a very safe, very effective vaccine. And as we've increased vaccination rates, we've seen a tremendous decrease in the rate of the disease. We've seen more than a 50-fold decrease nationally over those years, primarily eliminating a lot of the disease in children as well as some of the foodborne outbreaks. But there's still a lot of public health work to do, as is illustrated by your current outbreak.
So that's that's the question I want to ask. We develop the vaccine, the rate goes way down. So we now have a vaccine-preventable virus here. Why are we seeing so many hepatitis A cases emerging now?
Well, what you're seeing is the vaccine's, administered in childhood. It's only been around for about 20 years, so if you're 21 years or older, you probably haven't had it. Now, it is recommended that high-risk groups, such as, recreational drug users, as is part of the problem in Massachusetts, be vaccinated, and we haven't gotten to all those groups yet. So efforts to really find the high-risk individuals, which are well-defined, and to get them the vaccine would help prevent these outbreaks in the future.
Yeah, and this is part of what's happening in Massachusetts. We've been battling the opioid crisis for years, and hepatitis A is just another place we need to fight on this. But we are learning from this. Just this past October, the same CDC committee whose recommendations in the 1990s helped the rates of the virus decline sharply added persons experiencing homelessness to the list of those who are recommended to get hepatitis A vaccine. I see you're all nodding, right? So in Massachusetts, our public health workers, our community health centers, and our jails have sprung into action to try to get the vaccine to those who are most at risk. Dr. Weissman, as Secretary of the Washington State Department of Health, you oversee your state's public health response. What can we be doing to ensure that local public health officials have the resources they need to be able to do their work?
Yes, thank you. So really part of this is making sure that the Prevention Public Health Fund is funded and that we look at the funding to CDC. We've been asking ASTO, the Association of State and Territorial Health Officials, and local public health for increasing the CDC budget 22% by fiscal year 22.
All right, so we're talking money now.
We are talking money.
We're talking money. And whether it's a situation like hepatitis A outbreak in Massachusetts or the measles outbreak in Washington State, how do the preventive costs of a vaccine program compare to the containment and treatment costs of an outbreak?
Well, in general, we do know that for about every dollar spent on vaccines, you save about 10. So it's definitely a cost-effective intervention.
Good. So the more we do on the front end to ensure that everyone gets access to the vaccines, the less we'll see individuals contracting hepatitis A, measles, whooping cough, all of the other vaccine-preventable diseases. This administration has repeatedly sought to cut the Prevention and Public Health Fund, which supports key immunization programs, and they've continued their efforts to weaken the Medicaid program, which covers all of the recommended vaccines for children and for many adults as well. I am glad that most of my colleagues are on the same page about the importance of vaccines. Now let's make sure we're also on the same page about the importance of public health funding so people get access to those vaccines. Thank you.
Senator Roberts.
Thank you, Mr. Chairman. I'm going to go a little cross-current here, and I want to state that the importance of vaccine in infants and young people cannot be overstated. I understand that. Well, I want to talk about the seniors who are also at increased risk of experiencing serious and life-threatening effects of vaccine-preventable diseases. We have quite a few octogenarians in the Senate that get vaccinated, more especially with flu. Dr. Boyle, you touched on this with your reference to this topic on the effect of a herd immunity syndrome, which I appreciate, particular settings in which adults and seniors are more susceptible to infectious diseases if they are not vaccinated. I'd like to figure out if we can look for ways that federal programs can help by removing barriers to services like vaccines and providing the right incentives for people to use them. And what procedural barriers exist to ensuring seniors have proper access to vaccines? Do we need more education seniors provide to overcome these challenges? I'm going to give you a personal illustration. A young lady, but she was in her 80s, but she was young. she made sure that all 6 of her children got flu shots, and in turn all of their grandchildren, and that was a bunch of folks. And then yet she got the flu in Kansas this time around, bad, just a very bad flu season. And for some reason, she didn't get a flu shot. So here she is, a mother who has told her kids, get vaccinated, and made sure it happened. And then in her own situation, she didn't get the flu shot, along with her husband. We lost both. The sniffles became flu, the flu became serious, and we get into pneumonia, and we get into all sorts of other problems. And I'm not going to go into what kind of treatment they received. But they were very important folks, and they were pillars of their community, and they were still very active. I sometimes think that the octogenarian caucus and the Senate were known as potted plants. They're also known as chairman of the various committees around here. Dr. Omer, you've written about vaccine confidence, and I'm interested in how this applies to adults. In recent years, we've seen outbreaks of vaccine-preventable diseases in which unvaccinated adults are an important factor. CDC also noted that a drop in the immunization rate contributed to a rise in the hospitalization and deaths during the last flu season. I don't get it. I don't understand why, in a period of your life when you would be obviously saying, I need a flu shot, and then respond to why you didn't do it, so, well, we're just getting around to it. I don't know if any of you would like to offer any opinions. We're talking about young people all the time, but there are people who still contribute to this society, even though there's no bar graph after 80 for anything. We're just out there. Anybody want to comment? Dr. Omer?
So thank you, Senator. And the story you narrated is not unique, unfortunately, in this country and throughout the world. The elderly are one of the highest risk groups for complications after influenza. The vaccines are slightly less effective in the elderly, but that's the reason we need more of them to be vaccinated. And this is one of the gaps that I was talking about, that we don't have evidence base to communicate to several groups, including the elderly. And this is not a group that is actively opposed to vaccines. They have, the concept of vaccines, and they have seen what infectious diseases can do. But at that time, when a lot of the discussion has revolved around childhood vaccines, we need evidence-based strategies to communicate to not just the elderly, but also to their health systems. The providers who deal with the elderly don't have, unfortunately, the muscle memory to talk about vaccines and to make it part of their routine clinical practices. There's a lot to be done, and thank you for highlighting that issue.
Mr. Chairman, my time has expired. I want you to know that we did not plan this, Dr. Omer and myself, before the committee hearing, but he certainly hit the nail on the head. And I think it's an issue that we overlook. Thank you.
Thank you. Senator Kane.
Thank you, Mr. Chair, and thank you to the witnesses. This has been a fascinating topic. Timely, I noticed yet another study has come out just in the last 24 hours, a study dealing with a very significant longitudinal study of a big chunk of children in Denmark that also, again, demonstrates no link between the MMR vaccine and autism, and so it's a timely day to have this hearing. I want to ask a question about, begin with a question about vaccination shortages, which as a former governor worries me a lot. The problems in the supply chain that could lead to shortages of important medications. In 2017, outbreaks of hepatitis A increased demand and led to constrained supplies of that vaccine. Many constituents have contacted my office about their inability to access the shingles vaccine, Shingrix. So last June, I joined a bipartisan group of members of this committee in a letter to Commissioner Gottlieb urging him to convene the Drug Shortage Task Force to develop a report on the root shortage of drug vaccines. I look forward to reading that report, and I think it may be on the verge of being published. I think the committee has completed the work, and it's very close to publication. It might be worthy of some committee consideration when it's done. What more can we do? And I guess maybe I'll direct it specifically to Dr. Omer and Dr. Weissman. What more could we do at the federal level to make sure there's an adequate supply of vaccines?
Well, I'll just start out and then turn it to my colleague. So one thing we need to continue investing in vaccine research and figuring out new technologies for producing vaccines. We use sort of egg technology, and it's a very long, laborious process in many of these. So we have to move towards new technologies, I think, around cell-based or recombinant vaccines so that we can produce them more quickly and assure the safety. And it is a problem with the vaccine shortages.
Yeah, so one of my mentors has said a few times that it's not, a vaccine is in a vial, that remains in a vial is 100% safe but 0% effective. And so inventing a vaccine or developing a vaccine or licensing a vaccine is not sufficient. We need to have a stable supply of vaccines. And that requires, a federal-wide thinking and response, from regulation to working with our research entities to say that there is a robust pipeline of new vaccines, and there are multiple approaches. So infectious diseases attack our bodies through multiple mechanisms, therefore there are multiple vulnerabilities. So what it does is that it creates an intellectual marketplace of ideas, so that if there's more than one strategy that we are focusing on at the science level, we have more likelihood of having multiple products that compete with each other and have a sort of give us more options as a country. Then working with manufacturers, sort of ensuring that we understand that there is a stable manufacturing pipeline. The third thing is, sometimes in certain, especially in pandemics, etc., one policy intervention is BARDA, which invests in preparedness-related interventions. And for example, some flu vaccines that would be required in a pandemic, there it's in our interest to ensure a stable seasonal flu pipeline. And so there are interventions and investments which are a little bit more direct that sort of straddle that divide between emerging and routine vaccination, etc. So it will require a nationwide, a national response, not just a federal response in the sense that sort of bringing in states and other partners as well.
Thank you for that. Yeah, Dr. McCullers. So maybe be quick because I have one more question.
All right, very quickly then. Three quick issues. One is that these are for-profit companies generally that create the vaccines, and so having a federal buy that gives them some surety, it will make them produce more, which will help the vaccine shortages. The second is we really have a problem not so much with shortage often, but with maldistribution. So it becomes a logistics effort, and we could do better at that at the local level, being able to make sure every physician practice or hospital has that. And the third is really to reinforce the importance of the strategic national stockpile, which again keeps these vaccines in reserve when we might need them.
Thank you. I'll just, in my last half minute, Mr. Lindenberger, I just want to compliment you. We revere Jefferson in Virginia, and one of the things that he said that still is so powerful is progress in government and all else depends upon the broadest possible diffusion of knowledge to the general population. He believed that the diffusion of knowledge and giving people knowledge would enable them to make the right decisions. Now, fake knowledge, misinformation, intentionally misleading information can also be disseminated. And in this social media age with the internet, the competition between the true and the valid and the fake and the dangerous, even the manipulated by people who want to do us harm is very difficult. But I think it's interesting that, probably both your mother and you reached your conclusions because you had an internet and tools to do your own research. And so the difference between your mother and you were using some of the same tools and reaching different conclusions, but I applaud your critical thinking skills and your willingness to share your story.
Thank you. And I don't want to go over time, but just to comment on that very quickly, I think part of the issue is being able to inform people about how to find good information, because with my mother, it wasn't that she didn't have the information, but she was manipulated into disbelieving it. And so that's part of the attack, which is that the CDC was made out to be a fraudulent group that was pushing vaccines for its own demand, and that that's not the case, and that the evidence proposed is genuine. And so I just want to comment on that.
Yeah, my turn.
Let me give some color to what Senator Paul said. You may or may not know I'm a physician, and I've seen people who have not been vaccinated, who have required liver transplantation because they were not, and who ended up with terrible diseases because of no other reason than they just, for whatever reason, didn't understand vaccination was important. I think it's important to point out that even if flu shots are not completely effective, they do mitigate. And so there is a cross benefit that will decrease the severity, number one. Number two, hospitals commonly require their employees to be immunized because they understand that herd immunity is important. And if the nurse's aide is not immunized, she can be a typhoid Mary, if you will, bringing disease to many who are immunocompromised, as Mr. Boyle points out. And as regards the federal government requiring, there is a federal statute requiring that vaccine information statements should be given. That is a federal requirement. And in the name of liberty, we should rely, therefore, upon states and localities to make a further requirement, but they typically do require an informed consent. So that's important to know, not to be misled regarding that. Secondly, I think we should point out that in terms of a requirement, the requirement is just that you cannot enter school unless you're vaccinated. Now, if you're such a believer in liberty that you do not wish to be vaccinated, then there should be a consequence, and that is that you cannot infect other people. Mr. Boyle, if your child is born with immunodeficiency and someone comes to your school who is not vaccinated, and the lack of herd immunity means that your child, who, no fault of their own, cannot be immune, is it a victimless crime that somebody doesn't get vaccinated and your child dies? I mean, my gosh, you're the guy who's representing those people who, whatever reason, the vaccine doesn't work or they're particularly susceptible. Now, Dr. Weissman, I seem to remember a particularly tragic case in Washington State from about 6 years ago of a child who was immunocompromised on steroids, chemotherapy for cancer, and someone brought measles to the school, and I think I remember that child died. Do I remember that correctly?
If we're talking the same child, yes, died a number of years later from a follow-up reaction.
Now, so the parent has had the child vaccinated, but now she's on cancer chemotherapy and she's immunocompromised and she is in school thinking that she can be a normal child even though she's on cancer chemotherapy. But because someone else has made a decision not to vaccinate their child, her child dies. Now, if you believe in liberty, that's fine. Don't get immunized. But I don't think you need to necessarily expose others to disease. Dr. McCullers. Tell me, you're in a state, you mentioned a practice where you have people from 3 different states. And hats off to Mississippi. They always have the highest immunization rate. You didn't elaborate. What are the differences between the patients from these 3 different states in terms of, okay, Mississippi is always immunized. You imply that maybe Tennessee and Arkansas is not.
Right, so Mississippi does not allow any non-medical exemptions, and they have nearly a 100% rate of immunization at school entry. They pay a lot of attention to it. Tennessee's in the middle. They allow religious exemptions, but not philosophical exemptions. In Tennessee, we have about a 97% vaccination rate at kindergarten entry, but we've seen the rate of non-medical exemptions under the religious exemption triple in the last 10 years, so you can predict where that's going. Arkansas, on the other hand, allows both religious and philosophical exemptions, and has a rate that's around 93 to 94% below the level for community immunity.
And what state do you see the most vaccine-preventable diseases nonetheless presenting themselves?
Well, all of these are rare.
sides actually have to show that it doesn't materially hurt competition. So that would help in a merger situation. When you just look at the companies themselves and what's happening, I think that calls out for, as you're seeing across the world, investigations into whether or not there should be some consumer rules put in place. The merger legislation would help going forward. But the FTC has been looking at some of these things and then going at it, as I suggested, with the privacy rules. Not leaving anymore, we've just have your backs. Because the factors against us are huge. There's the factor of money and lobbying, which is at present in a lot of these industries, of course. There's a big factor here of members not understanding it, okay? Maybe you noticed some of the questions, you know, so, okay, so, you know, you have that, and it is very, and on their half, I mean, it is very complicated, right, and you can make yourself look like an idiot pretty easily, so, so there's that. There's the inertia in Washington when you don't have a big crisis going on. You know, they didn't do anything about Wall Street rules until we actually had that last crash. And so all of those factors are combining. But what I'm trying to say is we need to get ahead of this. It's so obvious when you look at people's data being stolen and what happened with Cambridge Analytica that we need to get ahead and work on these things. And there is starting to be more movement, especially the companies are now voluntarily doing some things. They have been smashed over the rocks for some of these things. And so hopefully we can get some bipartisan agreement that we have to move forward.
Did you want to respond to that?
Well, just let me say one other thing, and that is much of the job that the senator is doing, other leaders are doing in this space has to do with connecting the dots. You know, Amazon gets $3 billion offer from New York City. Why? How does that affect competition? When big companies hold essentially competition sales around the country, you know, you give me more or you give me more, that has a negative effect on smaller companies that can't enter into those kinds of competition agreements. Yeah. The same thing with, the senator mentioned, lobbying. There's also a big issue with freedom of speech because you've got these 4 or 5 huge information centers, information providers, they say just platforms. They're not just platforms. They're much more than platforms. And information has been weaponized, and we all know that. Connect the dots here about sort of the potential abuses of power and the actual abuses of market power, and you see that something has to be done.
Yeah, you say, for so long, every time we propose things like this, it was, you're trying to regulate the web. Ooh, you know, as opposed to saying these are actually big media companies and your information is a commodity. That's what this is, okay?
Senator Klobuchar, I want to move to a different area. You've done a lot of work on the issue of prescription drugs. We've been proud to host you at CAP to focus on some of your legislation in that space. How do you see the overlaps between competition policy and issues like high drug prices? Mm-hmm.
There's a big overlap there. Again, some of these same factors with Washington not acting, inertia. And finally, if you look at that last election, 2018, farmer prices were front and center. And I'm hoping that is going to finally move some of this legislation. Some of it is broad antitrust, the things we were talking about before, about how we need to change the rules of the road so we're as sophisticated as the titans that run these companies when it comes to our FTC and the Justice Department, but some of it is industry specific. For too long, pharma has thought that they've owned Washington, and I think we all know they do. But they don't own me, and they don't own a number of other people who have been starting to push for change. Ideas. One, we were just talking about it as we walked in, pay for delay, where big pharma is paying off generics to keep their products off the market. This is a bill I have that I'm leading with Senator Chuck Grassley, who now is in charge of the Finance Committee. So should be in a place where we can finally put this, because it saves money if we stop that practice, about $2.9 billion over a number of years. And so we want to put that in some bill. It's a great pay-for, as we call them in Washington, D.C., because it is a lot of money. Okay, that's one. Secondly, get less expensive drugs from places like Canada. You can do it like the bill I have, again, with Grassley. That was a bill with McCain, who I miss every day. But Grassley stepped into his shoes, and there are others. I think we had about a dozen Republican votes for something like that. And then the third one is to allow for Medicare negotiation, which could really help everyone if you unleash the power of 43 million seniors. And there's a lot of other ideas by my colleagues. I just put those out there. Those are the ones I've been working on for a while. But we have just seen no improvement. And when the administration put out their plan, the farmer prices, the stocks actually went up. So, I don't know.
Following recent mergers, a handful of companies controls 78% of the U.S. corn seed market. Speaking of farmers, I wanted to get to this. 78% of U.S. corn seed market and 70% of the international pesticide market. What does it say, Secretary Reich, what does it say about current markets and the rules we have established around them when even straightforward markets like agriculture, which are not technological innovation monsters or something, are subject to, have real challenges around competition?
Well, it tells you, Anita, that not only is this issue across the economy, but also that intellectual property is a big part of it. Mm-hmm. One of the reasons that you've got so much concentration in the seed corn area of agriculture is Monsanto, and it's basically intellectual property, predatory use of intellectual property, which means that many small farmers are being squeezed because you've got farm processors, on the one hand, who are consolidating like mad, pushing down the prices that farmers can sell their goods, their produce for. At the same time, you've got seed corn and a lot of fertilizers and other farm supplies that are consolidating, using predatory practices, using their intellectual property, and charging more and more. This is why this whole issue area ought to be bipartisan. This is the Farm Belt, with a lot of Republican senators and representatives, ought to be on top of this. Antitrust is not and should not be viewed as a democratic or progressive issue. This gets to the heart of our free market system.
Yeah, you guys heard of the Sherman Act? Do you think Sherman was a Democrat or a Republican? He was a Republican from Ohio.
But I think
and Teddy Roosevelt
was a Republican.
So I think this actually gets to what some of the fault lines on thinking these days. So antitrust is a means by which you make a market work better, right? So it is a theory of, it's a pro-capitalist tool, pro-capitalism tool to make markets work better for people. And yet we have so much opposition to, or, people not doing anything, et cetera, because of the voice essentially of business lobbying, etc. So how do we break through the theory that anytime government does anything, it's hurting the economy? Particularly in this arena, you have an example where antitrust is actually really just about using rules to make the economy work better. As you said, Republicans should be supporting these proposals. They should be bipartisan. In fact, they're pro-capitalist arguments for regulation, but we haven't seen Republicans or too many championing antitrust, particularly in this moment where we have such a large increase in monopolies that are affecting consumers and affecting wages. So how do we break through that? Do we talk about it? Is it a political discussion? Can we get Congress to act differently? Maybe I'll start with you, Secretary Reich, and then Senator Klobuchar, and then we'll get to some solutions and go straight to the audience.
I think partly it is a public awareness issue. Antitrust, you talk to people with their eyes glazed over. They don't know it. There's got to be an understanding that antitrust is not only vital to the maintenance of capitalism and our markets, but also it's cool, as the senator said initially, and that it is the sole alternative we have to regulation. That if we are not going to use antitrust creatively, and I'm not saying just bust up everything. There are a lot of other things you can do. You could have mandatory licensing, you could have sharing of data, you could do a lot of things. But if we're not going to use antitrust, then you do have to depend on regulation. And those are the only alternatives because we can't sustain the direction we're going in.
It has to become part of the political dialogue. I'm hoping it will in this 2020 election. It seeped in through the pharma issue in 2018. But when you look back in history, it literally was a defining part of the campaigns. Wilson actually had a song about antitrust that people would
He
sing.
sang it. It was not very, very good. It wasn't
Okay, all right. Okay,
make the charts.
He had that. And you look at the video that the Secretary has put out there. And there are a number of books coming out, actually, in the next year by a number of people on this topic. I just think we have to start talking about it again, making it simpler. I remember being in a cafe in Albert Lea, Minnesota, and this woman turned around. She was with her husband and her husband's brother, and they were older farmers. And she turned around, she said, "I saw you on TV." It was like a year and a half ago. And I go, "Oh, our staff is there." I go, "Was it about Russia?" Because I've been doing all this stuff on Russia. She goes, "No, it was about big." And I go, "What?" She says, "Big, about how things are too big, and that's bad for us because it's bad because of the trains." And she started using examples of them with input costs for farms, basically, and why big was bad. And I thought, okay, that actually is something that she heard and listened to. So it is not crazy to start talking about antitrust. We just have to do it in a way that's understandable and get the media to be interested in it outside of one story about Donald Trump, which is important, trying to meddle and influence a legal decision. That's important, but what's really important is what all of this over a span of decades now is doing to consumers if we just sit back and do nothing.
So I hope people get ready for questions. Just going to ask each of you. We've talked a lot about challenges and some about solutions. But if you wanted to just, Senator Klobuchar, discuss, your proposals in this space and why you think they'll be helpful.
Sure. I mentioned the drug proposals. I would add one more. That's actually a Leahy, Grassley, Klobuchar-Lee bill, which is CREATES Act. And that has a possibility of passing this year. That's about trying to make pharmaceutical companies give samples of their drugs to generics so that we can get more generic competition out there. But the bigger antitrust solutions to me are two bills that we've worked on over a period of time. Right now, unfortunately, they only have Democratic co-sponsors. But one is to increase the fees on mega mergers. This would be a drop in the bucket for these companies when it's between $2 to $5 billion for a transaction, and it would allow us to then have these fees that could be used to finance more sophisticated reviews of these mergers from the FTC and from the Justice Department. That has some possibility of bipartisan support depending on how we do it, because it's not coming out of the taxpayers' money, it's coming out of these mega mergers. And we clearly need resources in these areas. The second one is, as I mentioned, to change some of the standards to match our changing times, to switch the burden of proof so that a company for these big financial transactions has to actually show it doesn't materially reduce competition, to start looking at monopsonies as a factor, to switch the standard from substantially reduce competition to materially reduce competition. Those are all contained in one of the bills we have with a number of co-sponsors. I'm not out there alone, but talking about this and getting this out there would be very helpful.
Secretary Rice, do you have additional thoughts?
Well, let me just say that there is no issue I can think of that combines populism and conservative free market principles better than antitrust. Let's hope that Republicans begin to understand the power of antitrust. We cannot take the free market for granted. There are sectors of this economy that are hurling toward a degree of concentration of economic and political power that we have not seen in this country since the 1890s. It's dangerous for our markets, it's dangerous for our politics, and antitrust is one of the most important weapons we could have.
Thank you. All right, we have time for questions. Wait for the mic, and if you want to identify yourself, that'd be really helpful. And just try to make the questions as quick as possible.
Mike Golash, the Amalgamated Transit Union. one of the things that you haven't really addressed is that there's an awful lot of laws in this country which will limit the ability of workers to act collectively. Taft-Hartley, secondary boycotts, things which would give workers more leverage in dealing with some of these issues. I'd like you to address that a little bit.
Sure. Maybe we'll let the Secretary of Labor start, huh?
Well, worker organizing is the flip side to antitrust, because what we've seen since, certainly over the last 50 years, is that as antitrust has receded, labor laws have not protected worker organizing, and workers have less and less bargaining power. So if you wanted a cartoon version of an answer to why profits as a percentage of the national economy have continued to rise and wages as a percentage of the national economy have continued to fall, the simple version would be bargaining power on the side of very large corporations has increased, bargaining power on the side of labor has continually decreased. So that's just a long-winded way of saying you're right.
Senator Klobuchar, do you want to say something?
I don't know what I can add to that. You're right. But that it is that power. So as I was listening to the Secretary and you, I was thinking this is a very interesting way to go at this in terms of explaining this. The major power at the top then squeezes out the workers because it means that they don't have as much to bargain with. That's all it is. They don't have other companies they can go work at, right, if you only have one or two of them. And you add to that the pushback from states, like my neighboring Wisconsin in the past, on labor laws, and you have a situation where workers are basically getting screwed because of the consolidation at the front. And you look at it historically, as Secretary Reich knows, that is actually, it came up together, right? The Haymarket riots, what happened in Chicago, as the farmers were protesting with the Granger movement about what was happening with their prices, and they had no way to go to get things to market, the workers were protesting along a lot in the industrial Midwest about what was happening with their wages when you had these companies like Pullman, right, that were controlling everything about their lives, and they were not able to work anywhere. Their wages were down, and then that's what led to some better labor laws, but also antitrust. A lot of the focus of the workers was on antitrust.
Other questions? There's the one in the back, right back there. And just identify yourself.
Luther Lowe from Yelp.
Hello, Yelp.
Hello, Senator. I was curious.
Did you say Yelp or Yale?
Yelp.
Got it. Two different things.
I was curious, so I kept
Tell
telling
them your job with Yelp so everyone knows who you are out there.
I'm the SVP of Public Policy. I've been kind of keeping loose track of how often we talk about Google, Amazon, and Facebook, and just out of curiosity kept tally and noticed we mentioned Facebook 5 times, Amazon once, and Google 0 times. So my question's about Google. We have a Google representative appearing alongside the Secretary in the hearing later today who's kind of triple dipping on their payroll. Google was the biggest spender in Washington last year, and while we're in the house that John Podesta built, Mark Zuckerberg and Jeff Bezos were not sending lengthy campaign memos to the Clinton campaign years before the election. Eric Schmidt was, and so they have this unique kind of obsession with soft capture. So my question is, do you think that, in your opinion, both to the Secretary and the Senator, has the 2013 decision to close the investigation into Google's unilateral conduct aged well, and should the FTC reopen that investigation?
Well, I would like to see an investigation. We have talked about this. Certainly you don't want to just stop things back in the year 2013 when you've seen changes, and you've seen changes across the world in how they are looking at the activities of the Google and the other social media platforms. So I don't think that was our witness, right? Is that right? How did that all work, of who the witnesses were at the hearing? Yeah, okay, they're going, no, says Mark, no. But in any case, that will be ripe for asking questions about this this afternoon. And I thank you for your work. As you know, Yelp has been out there on the cutting edge, trying to get in the market and understands the issue of what it's like every day. And this is one example. We have so many companies. I think people think of, oh, this is antitrust, and consumer groups are the only ones that are coming to Washington about it, as they should. But there's a lot of companies that feel that non-enforcement, allowing things to go as they are, hurts new companies from getting in the market or expanding. And Yelp has a lot of examples of that.
In fact, the rate of new business formation, according to the Commerce Department, continues to drop. It's about half what it was in 2004. And I think the barriers to entry that we're talking about here with regard to these big companies, particularly big tech companies like Google, I'll mention Google very explicitly, have created, made it difficult for the Yelps of the world to get in. Just one quick thing. When you say soft capture, that was the verb or the verb tense you used with regard to Google. It's an interesting way of talking about a kind of a predatory behavior. When Google subsidizes, for example, the New America Foundation, and then takes money away or threatens to take money away if the New American Foundation investigates antitrust and researches antitrust, or Google has a huge number, according to the Wall Street Journal, of professors and researchers on its payroll who testify about antitrust and basically protect and defend its market power. That is an incursion on the marketplace of ideas. It's not just the marketplace. It's one of the most important marketplaces we have in this country, and I think that that is an abuse of power, quite frankly.
Great. Questions up here? Do I just somewhere on the aisle? Great. And just a reminder to say who you are and where you work.
Hi, my name is Madison. I'm a student at NYU's Washington, D.C. campus around the corner. And one of the things that I've been struggling with as a young person getting started in Washington is this idea of spending a life and a career as a dissenting voice. So I was wondering what advice the three of you have for young people who want to get it started in politics to combat the sense of outraged fatigue and keep fighting against political turmoil and against lobbying money to actually make the country better.
Go into antitrust. We really need dissenting voices. But I think you know the excitement going on right now of people that want to see change. You just don't have to go very far. If you're here when you saw what happened the day after the inauguration with millions of people marching, and you go through the last 2 years where people have been activated like never before. So I always tell people to get involved in campaigns. It doesn't always have to be the national campaign. Sometimes it's fun to get involved in a local issue where you can have more of a voice in a campaign, and then advocating for an issue that you care about. And I'm kind of kidding about antitrust, but I'm kind of not. So figuring out something you care about and getting involved in that, and it can be part of your whole job, or it can be something you're doing as a volunteer. But it's really a way to, I always, when I got out of school, I had some student loans, and I didn't go right into government, but I started doing campaigns and getting involved on the side, and then that led somehow to this. So there you go.
And if I could just add to that, Madison, if you're a dissenting voice and you dissent long enough and hard enough, and you convince enough people, you're no longer a dissenting voice. And I can speak from experience.
Amen. I'll just say one quick thing about this, which is that I know that we live in an incredibly cynical time, and things that happen every day make us much more cynical. But I have worked on legislation that was opposed by industry and opposed by an entire political party, and 25 million Americans have health care, even though they fought against it. And that was not perfection. It was part of a political process. But millions of people have health care because of that political process. And that is the way we make change in our country. And people who feed cynicism want you to stay home, and people who fight cynicism want you to get involved. Over there? Go ahead.
Yeah. Excuse me, Larry Checco, Senior Advisor to Serve USA. I think we really know what's wrong with this town. It's been bought, top to bottom. and mentioning health care. I really think that the Obama administration would have had a lot better chance of selling the ACA. Instead of calling it the American Health Care, they should have called it the American Health Insurance Reform, because nobody's really upset about their health care. It's their gatekeepers. It's the insurance companies. So I think had they branded it as health insurance reform rather than health care reform, but I think the reason that didn't happen was because there's too much health insurance money up on the Hill. And I think that's the problem. Would anybody care to speak to that?
Well, it has been the time-worn problem in Washington, and it's just been getting worse and worse. And there's things that we could do to fix this outside of antitrust our subject today. The first is to overturn Citizens United with a constitutional amendment. It sounds like a stretch, but not if we make democracy repair a major part of what's happening in 2020. And I think that would help immensely, because you would get the dark money out of politics and be able to at least hold people accountable for their own campaigns. You should make it easier for people to vote. And that is everything from, I have a bill to allow kids to automatically register if they're eligible when they turn 18, right? Pretty simple. To fixing the voting rights, do the reauthorization that we've been held back on. So I think actually I was one of the campaigns in Minnesota in 2018, Angie Craig, who's a new member of Congress who beat a Republican. She actually ran ads showing people trying to speak in front of a bale of hay, right? Her district is a combined suburban rural district, but you couldn't hear their voices because they'd been squelched by big interests. I think that district, by the way, is not a super liberal district, right? These issues transcend parties, and we just need people, and I know I'm going to do this, making it a centerpiece of what we do going forward to win in 2020. And the way you then get these changes made that we're talking about here is by getting people that are willing to make those changes into office.
If I could just add that H.R. 1 is a very important beginning with regard to some of these democracy issues.
I was thinking too, Senate, like H.R. 1 is the key.
And the democracy movement, the incipient democracy movement that has to do with getting big money out of politics, is intimately tied to this issue of antitrust. You can't separate them.
Outstanding. I think that is a fantastic end to this discussion. I want to thank you both for being here, but also thank you for championing issues that help families and our economy together. So thank you both, Senator Klobuchar.
Thank you, everybody.
Professor Wright.
We ask that everyone please remain in their seats while the Senator and Secretary exit. Thank you. Please remain in your seats.
You don't remain in your seats. You guys do.
Yeah. Thank you.
Thank you.
Did you have any questions here, these guys? They were with me, Ajay and Mark. And Mark said the FTC I can reach out to our office. So. Thank
you. Tonight on C-SPAN, the producers of the PBS Frontline documentary, The Facebook Dilemma. They talk about their investigation into the social media platform and its impact on global privacy and democracy.
We had a great conversation with Alex Stamos, who's the former chief of security for the company, and basically, I think better than anyone, he laid out a lot of the dilemmas about, okay, be careful what you wish for. Right? You have an incredibly powerful internet platform here. You have other incredibly powerful internet platforms. And what happens if you draw out a scenario where they become proactive now in kind of regulating speech? And then what happens further down the line when there are AI tools to start detecting speech and taking it down before it's even posted? And you could end up with a pretty Orwellian scenario when it comes to political speech. And also the main question of thinking about leadership at these companies, that as critical as the film may have been or comes across when it comes to Mark Zuckerberg, with someone else in charge further down the line who may not who's under no obligation to keep it a quote-unquote neutral political platform, what could happen if there were internally decisions to be made that were in fact biased, and where the algorithms were biased. So that's another scenario that we, you know, it's pretty frightful. And I don't know the solution to that. I think that that's something that smart minds at campuses like Stanford should be discussing as to where do we want to go with that? Where do we draw those lines?
You can watch that entire conversation with the producers of The Facebook Dilemma tonight at 8 Eastern here on C-SPAN. In the Alabama State of the State address, Governor Kay Ivey talks about her proposed local fuel tax increase to help pay for the state's infrastructure needs and recovery efforts following recent deadly tornadoes.
Thank you all so much. Lieutenant Governor Ainsworth, Pro Tem Marsh, Speaker McCutcheon, Speaker Pro Tem Gaston, members of the Alabama Legislature, Chief Justice Parker, and justices of the Alabama Supreme Court, distinguished guests, and my fellow Alabamians. Just over 48 hours ago, Mother Nature's wrath in the form of vicious and deadly tornadoes ripped through our state, leaving behind significant devastation. At least 23 lives were lost. Young children, mothers, fathers, friends, and neighbors. Y'all, it's during times like these that we turn to the good Lord, asking for his continued comfort and healing. We also give special thanks for the emergency responders and local law enforcement. Please join me in a few moments of silent prayer as we remember those who have passed away, as well as those who were injured and are still suffering tonight. Would you pray? And all God's people said, Amen. While there is always uncertainty about what tomorrow might bring, there is absolute certainty in the resilience of the people of Alabama. After all, we've done it before, and we'll do it again. This is the time for all Alabama and our entire nation to rally behind these good people. Together, we will bring Lee County back to its feet. In our 20 years of statehood, the men and women of Alabama have always stepped forward when our nation called. And when our country needed defending, the legendary Tuskegee Airmen were born. When our country was plagued with injustice, it was an Alabama woman that refused to give up her seat on a bus. And when our country sought to do the impossible and take man to the moon, it was Alabamians that built the rockets that successfully launched and returned them home. The people of our state have shaped the past, they are influencing the present, and without a doubt, they're at the forefront of defining our future. Since this occasion last year, our story in Alabama has continued to evolve with one major accomplishment after another. And at the same time, we are managing to fund state government, remaining conservative with the hard-earned dollars the men and women of this state send to us. Ladies and gentlemen, this evening I am proud to report to you that the state of our state is growing stronger each day. Our recent state's history, combined with the willing attitude that I sense in the chamber this evening, will aid in our quest to overcome our long-neglected issues and will help us achieve even greater prosperity for the entire state. We will accomplish this together because we are Alabama and this is our time. Alabama's economy is breaking records some thought we would never see. In 2018 alone, Alabama achieved a historic total of $8.8 billion in new capital investments, which created more than 17,000 new and future jobs for our people. Major technology companies like Amazon and Facebook, Google and Shipt are showing the rest of the country what it means to do business in our state. Alabama is on track to be the #2 auto-producing state in the nation in less than 5 years. Now, you know, that's pretty remarkable since 25 years ago, we did not produce a single car, truck, or SUV. And our aerospace industry is once again redefining the futures of both of our state and our nation. With the recent groundbreaking for Airbus's second assembly line, the city of Mobile is positioned to be one of the top 4 cities in the entire world for aerospace manufacturing. And up in Huntsville, construction has begun on Blue Origin's $200 million rocket production facility, further solidifying Alabama's critical role in putting the United States at the forefront of space exploration. Now, just as Alabama has emerged as a powerhouse in the automotive and the aerospace industries, our Department of Commerce, under the direction of Secretary Greg Canfield, is working hard to expand project activity in areas like technology, forestry, and bioscience. Members of the legislature, companies from around the globe want to be a part of the gold standard that is known by the Made in Alabama brand. no mistake about it, the upward trend in Alabama's economy is a direct compliment to the men and women in Alabama's workforce. These very men and women are regaining hope because of the good-paying jobs that are pouring into our state. The Department of Labor, under the capable leadership of Secretary Fitzgerald Washington, is working hard to ensure we fulfill our vision of connecting every Alabamian who wants a job with a job. Ladies and gentlemen, Alabama has seen a record-breaking year. Last year, we recorded the lowest unemployment rate in our history, 3.7%. That's a record for our state. In December 2018, Alabama reported having the most people working in our state's history. That means 49,000 more Alabamians are working today than were working a year ago. That's a record for our state. When economists predicted that we would gain 27,000 jobs in 2018, in natural Alabama fashion, y'all, we exceeded that projection by supporting more than 44,000 additional jobs. That, too, is a record for our state. Even so, there are some 80,000 Alabamians seeking employment opportunities. And to those across our state tonight who are still searching, I urge you not to lose faith, because we are not going to rest on our efforts, and we will not leave you behind. Regardless of an individual's own individual situation, every Alabamian must be given the opportunity to provide for themselves and their family, enabling them to climb the ladder to success. For us to better provide for all of our citizens, it is vitally important that Alabama has maximum participation in the upcoming 2020 census. We will be launching the Alabama Counts campaign next month, with the goal simply being to secure much-needed federal funds for our state. And at the same time, we are ensuring that our representation in Congress remains unchanged, guaranteeing Alabamians a strong voice for the next decade. As you would expect, the hardworking men and women of Alabama will always come first in the Ivey administration. Under Republican leadership over the past few years, the people of Alabama have experienced major gains. We have seen significant growth in our economy. We have cut taxes on middle-class families, and we are shrinking government. You know, sometimes people just forget that during the past few years, we have repealed more than 300 obsolete laws and regulations. And since 2010, we have reduced the number of state employees by more than 6,000 people. That means we are operating leaner, smarter, and stronger. And because of the approach taken by Republican leadership since 2010, Alabama has literally saved hundreds of millions of dollars. And as we know, every dollar spent by government belongs to the hardworking men and women of our state. Last year, I was very proud to sign into law the largest tax break for middle-class Alabamians in more than a decade. In turn, the total impact is projected to net $40 million over the next decade, and all of our efforts are centered on doing what is right, what is best for the people of our state, and that begins with protecting their hard-earned dollars whenever and however we can. Doing what is best and right for our people also means giving Alabamians opportunity for a quality education. Through Strong Start, Strong Finish, we are making important strides to improve Alabama's education system. For a child to reach their fullest potential later in life, they must first build a strong educational foundation. Under the nationally recognized leadership of Secretary Gina Ross, the tremendous efforts under Gina Ross, the tremendous efforts of the Department of Early Childhood Education have enabled Alabama's first-class pre-K to be ranked as the nation's highest quality program for the 12th consecutive year. Gina, thank you so much, and more importantly, our efforts are giving more of Alabama's children a strong start. Last year, we increased funding by $18.5 million in first-class pre-K, which is the largest single-year increase ever approved. And because of that historic investment, 107 new first-class pre-K classrooms were added last fall, which led Alabama to officially break the 1,000 classroom mark. And additionally, our P through 3 pilot program aimed at building upon the gains made in pre-K grew by 75 classrooms this school year. As we anticipate the rising demand of the computer science field, we are continuing our efforts to enhance computer science education in Alabama. Last year, I signed legislation establishing the Alabama School of Cyber Technology and Engineering. We also secured additional funding to create the Alabama Math and Science Teacher Education Program, which provides a better pathway to certify future computer science teachers. Today in Alabama, women and minorities make up well over half of the population. Yet they are underrepresented in the STEM professions. Tonight, I am pleased to have with us a young woman who is the face of changing this disparity, specifically in the area of computer science. Arrington Harper is currently a senior at the Alabama School of Fine Arts in Birmingham. In her 9th grade year, she had her very first computer science class. And since then, Arrington has excelled. She is a recipient of the Aspirations in Computer Science Award for Alabama. She is an advocate for computer science education and girls in computer science. She wants to use her passion to help address the gender and race gaps that exist in computer science education. Arrington has spoken to numerous groups of parents and educators and was invited by the National Center for Women in IT to share her experiences at large. She plans to major in computer science in college. Now, Arrington represents my vision for education in our state. It was in a classroom where she discovered her niche. And through the guidance of her dedicated teachers and her own hard work, this young lady is headed into a very promising future. Arrington, please stand and let us recognize you. Arrington, we are mighty proud of you, and we thank you so much and appreciate your grandmama, Ms. Cooper, being with you tonight. Equipping our students with the proper skills and education to fill high-demand jobs is essential to ensure their strong finish. Part of my mission for the state is to carve a path for our students to enter the workforce, and so that they'll enter the workforce with highly skilled and well-equipped. To further our efforts, I'm asking the legislature to fund our new co-op program for the Alabama Historically Black Colleges and Universities. This program is geared specifically toward Alabama's HBCU students interested in pursuing careers in the science, technology, engineering, and mathematics fields. Now, it's not only a win for these students, it's a win for the colleges and universities. And it's a win for our employers who are gaining qualified individuals to strengthen the work of their company. Each year, as you know, the uses of the internet intensify in dynamic ways. Delivering high-speed broadband access is absolutely necessary. Last year, through the Alabama Broadband Accessibility Act, we connected broadband in 7 counties. One notable example is in Choctaw County. Within the next 2 years, more than 700 residences and businesses will have access to high-speed internet service. Thanks to this grant program, living in rural Alabama does not mean being cut out. This is a major step for education, for economic prosperity, and for the entire state of Alabama. In our efforts to meet the current and future needs of business and industry, I have established the Governor's Office of Education and Workforce Transformation. The focus will solely be on aligning our workforce development funding streams to create the most effective workforce development programs for Alabamians across the state. Since we met last year, I have been ambitious in our efforts to improve Alabama's education system, and we are now on our way to providing all students a quality education. Each of us has our own story to tell. My own story began in the public schools of rural Wilcox County, Alabama. I graduated from high school in a class that had 35 students. My surroundings at Auburn University would look a whole lot different. Instead of a class of 35, I would be in a class of a university of more than 12,000. My Wilcox County upbringing would be put side by side with some of the smartest young people from bigger schools in larger cities. However, I just wouldn't let these challenges hinder me from achieving success. So in the summer, before my first semester, I spent a full week on campus to walk the grounds to know exactly where my classes would be located, and also to try out for the Auburn University Marching Band. Ben Franklin said it best: if you fail to plan, you're planning to fail. I worked hard and planned for success. And my journey from Wilcox County also brought me to where I stand this evening. And despite the heavy challenges that lie ahead, we in Alabama must plan for success. And part of that planning for that success is ensuring that we have a robust economy and ample public safety. Now, we can help tackle both of these issues with a reasonable increase in the investment we make in our state's infrastructure system. Almost 3 decades have gone by, and Alabama has not made one change to our infrastructure funding. While our neighboring states are increasing their revenue for their transportation budgets, Alabama has not. Folks, we are dead last. And certainly motorists experiencing firsthand the poor conditions of Alabama's infrastructure is a problem. Each year in Alabama, 69 billion miles are driven on our roadways. We have urban roads in poor condition. Our drivers are experiencing major congestion on our freeways. County governments currently operate on a 56-year resurfacing schedule, when in fact, we should be operating on a 15-year rate. In Alabama, half of over our 16,000 bridges are older than their 50-year lifespan. Bridges should be replaced every 50 years. Yet county governments are on a schedule to replace their bridges every 186 years. Folks, that's almost as long as Alabama's been a state. From 2015 to 2017, Alabama saw nearly 3,000 traffic fatalities. and 1/3 of those were due to deficiencies in our roadways. Each year, $436 billion in goods are shipped to and from businesses using our state's roadways. The Port of Mobile, Alabama's only deep water port, moves approximately 64 million tons of cargo each year. Deepening and widening the port will increase Alabama's capability, and this will enhance our status as a primary industrial and agricultural hub in the Southeast. Driving on these rough roads costs the average Alabamian $507 annually in additional vehicle maintenance, and that's a total of $2 billion statewide each year. That is why we are proposing a 10-cent increase in Alabama's fuel tax. This increase will be implemented over the next 3 years. And I want to be crystal clear with you. This money will be scrutinized and watched over every single penny. There will be strong accountability measures to make sure that these monies are spent solely on transportation infrastructure, period. Leading the charge in the legislature on this issue is Representative Bill Poole. He, along with Senator Clyde Chambliss, will guide this legislation over the coming weeks. And I indeed thank both of them for their dedicated leadership and willingness to lead this opportunity. Additionally, I have listened to leaders making some good points about money being diverted from the Alabama Department of Transportation to supplement our court system and the law enforcement agency every year. I believe that we should begin to unwind this outdated approach. And in fact, the budgets I am presenting will cut this annual transfer in half without hurting the court system or our hard-working state law enforcement officers. A renewed investment in infrastructure will lead to safer roads, economic prosperity, and an enhanced quality of life. Ladies and gentlemen, I am willing to call you, the members of the Alabama legislature, into a special session if necessary to focus solely on passing this critical legislation. It's time to make our crumbling infrastructure system a problem of our past. This is a challenge that is felt by every Alabamian, clearly making this issue a bipartisan issue. And as governor, I say enough is enough. Now is the time to rebuild Alabama. Another problem that has gone unaddressed for years and years is that of the horrendous conditions of our prisons. Our next step, however, must be to address the issue of understaffing to improve our recruiting and retention efforts. Alabama is currently under a federal court order requiring the state to roughly double the number of corrections officers over the next 2 years. And if we fail to resolve this apparent issue of understaffing in our prisons, federal courts will dictate what needs to happen in our own state. And I am proposing that we include an additional $31 million in the general fund budget. This will allow us to hire 500 new correctional officers and increase the pay scale for all prison security personnel to make their salary competitive. Folks, this is an Alabama problem that must have an Alabama solution. And as we move forward, we must continue to wisely use our funds. I'm proud that the general fund budget I'm proposing will do just that. As a positive sign of that progress, Medicaid, under the capable leadership of Commissioner Stephanie Azar, will require $40 million less in 2020 than compared to 2019. The Medicaid program in Alabama is driving efficiency while being prudent with our taxpayers' dollars. I'm also proposing an additional $7 million to fund important mental health programs in our state. And as governor, I will do everything in my power to make Alabama safer, which is why my general fund budget includes funding to hire and train 50 additional state troopers. I have also included in my budget a 2% pay raise for all state employees. These men and women went too long without merit raises, and with the increase last year and the additional increase this year, we are making it right. Like my general fund budget, my education budget is practical, while still helping more Alabamians receive the opportunity for a quality education. My education budget will provide $25 million to expand our nationally recognized first-class pre-K program. This significant increase will expand the program by 193 classrooms. And this will be the largest investment in Alabama's first-class pre-K to date, and takes us even closer to providing more of Alabama's youngest learners a strong start. Alabama's institutions of higher education are making major research contributions. They generate significant revenue for our state. They serve as a major part of our identity in Alabama. And most importantly, they are preparing hundreds of thousands of students to enter the workforce. And because of their significant contributions in our state, my budget provides an increased investment of $75 million to our four-year public colleges and universities. These institutions are essential to the future of our state. Alabama's teachers are vital to our students throughout every step of their learning journeys. And these teachers deserve to be the highest paid public employees in our state. So that's why tonight I'm proposing to the legislature a 4% raise for all teachers, pre-K through community college. You see, without our teachers, our students cannot achieve success. The foundation for a strong future for all Alabamians begins in the classrooms. And members, I remind you that our long story in Alabama will go long past the time that you and I are in office. When we make improvements to our state's infrastructure, to our prisons, and to our education system, we are planting a seed of opportunity for Alabama's next 200 years. Ladies and gentlemen, I am a governor looking beyond the next 4, the next 8, or even 10 years. I'm a governor leading our state into the next century. I am all in, and the people of our great state need you, the legislators, to be all in as well. Democrats, Republicans, progressives, and conservatives To achieve a better future in Alabama, all of us must be willing to build on our successes. We must be willing to overcome our long neglected issues. We must be willing to take the next step, because we are Alabama and this is our time. And may God continue to bless each of you and the great state of Alabama.
A few days after that speech, President Trump and First Lady Melania Trump paid a visit to tour storm damage in Lee County, Alabama, where they were joined by Governor Ivey and local emergency officials.
What you can do when you stay together and work together and stand up together. And thank y'all so much for being here. Kathy, how you this morning?
I'm doing better today.
She's doing great. This is something really bad.
Mr. President, what did you see from the air?
Well, I saw this. It's hard to believe, actually, and I guess the fact that we went very early helped a lot of people, but we saw things that you wouldn't believe. Here it is. We saw the same thing. Catherine's done an incredible job, and the governor's done an incredible job, and we really appreciate it. Really,
we thank you and the First Lady for taking time to come and show how important it is for people to work together and stand up together. And when we do that together, we wind up being stronger together. And so y'all have set the bar pretty high, and we thank you for that.
Thank you very much. I appreciate it.
Volunteer support has been impressive. Over 1,200 folks have already volunteered from all over the state, and they'll continue.
They've done an incredible job, and I want to thank FEMA. All of our people from FEMA, they've been very quick acting, Catherine.
We have at least 200 here in the
Yep.
county, and they came to the EOC, and they are willing to work and do anything they can for these people. So we appreciate that very much. But the support that we've had from the state, the locals, our local responders, and the sheriff, and all of them is just unimaginable. Director Brian Hastings has been with me the entire time, and you know, one of the things, you can't afford to staff enough people to manage something like this all the time. So sometimes it's difficult for a local EMA to grow big enough, fast enough. And how you do it is through, like Governor, telling them, do whatever you have to do. I got word early on, Governor, that you said whatever they need, give it to them. And that's how we grow it.
When the president called me on Monday morning about 8:15 Alabama time and told us that y'all were thinking about us and if there's anything that you could do, and I said, well, as a matter of fact, there is. We're working with FEMA to coordinate that emergency disaster approval, and you responded quite favorably, and so FEMA has been right on top of things from day one.
They have.
And we're grateful.
Let's go take a look.
Would you like to?
Thank you, fellas. Thank you.
In the Florida State of the State address, Governor Ron DeSantis outlined his legislative priorities, including health care, education, and immigration. From Tallahassee, this is a little over half an hour.